Can everyone on Zoom hear us okay?
Yes.
Thanks, Jess.
Okay, it is 4:30, and so I will call the meeting to order.
Amy's walking in right now.
Okay, good. So first item on the agenda is the roll call, and I'll do it very slowly because we have someone coming in right now, which will make our quorum. Tom Betcham.
Here.
Dr. Marsha Horowitz. Here. Amy Crow Sunley.
Here.
Larson. Here. Jessica Smith.
Here.
And Dr. Schultz. I think Dr. Schultz will be joining us around 5, and Adam Hoffman did let us know that he would not be here tonight because he's in Sweden with his class, teaching a class, so he won't be here today. The next item on the agenda is public comments. At this time, anyone may address the board on matters of which are on the agenda. Please raise your hand on Zoom or speak up here in the room. State your name and home address. Individual remarks will be limited to 3 minutes. Would anyone like to speak? Seeing no one. I don't see anyone on Zoom and no one here in the room. All right, thank you. Next is our chairperson announcements and updates. And I have a few tonight. I went to the Board of Supervisors work session. We were invited to the work session this past Monday. And so I was there and Samantha was there, and we both spoke a little bit, not much. The supervisors have some concerns about our proposal. And so they've invited us for another work session, and Jay in particular, Jay Wickham, mentioned that maybe some other members of the board could be there or would be there. He said, you know, they've seen me a couple times now, and so hopefully some of you can come and actually speak and try, and what we're trying to do is answer their questions so that they'll give us the ARPA requests for the 3 new staff people.
Are there questions that you weren't able to answer?
Kind of, yes.
Okay.
The one question seems to, one question is, do we plan on hiring these people right away? Or are we going to wait until the executive director is in place and let the executive director hire? And I can't answer that. I don't know what the board wants to do, but we don't know exactly how the executive director search will go. We have a timeline and we have high hopes, but there's no guarantee when we'll have the executive director. So I hate to put off the new positions, you know, for that long, if it happens that it takes us a while to find an executive director. So that was one question. And then another question is, how will it be paid for after the 4 years? If they add staff to our department, they need to look at and want to see numbers and things like that as far as how much it will cost in the future. And back when the proposal was made, there was a budget worked out. So that's kind of in place. But we are invited to another work session. And they've suggested that it be a joint meeting with the Board of Health and the supervisors.
And that was June 6th.
That's what they mentioned, but then Samantha mentioned, Samantha, do you want to go ahead?
Yeah, I just received an email asking us to let them know what date. So I think there's some flexibility with the Board of Supervisors. If there's a different Monday that works better for the board.
And the thing about, if it's going to be a joint meeting, then we would, if we want to take possible action, we'd have to have a quorum there. So we'd have to have at least 4 people. Otherwise, we can just keep it as a work session and go in and do some sort of presentation. So go ahead.
Yeah, it seemed to me that it would make sense to have a quorum there so that if they ask a question, we as a board can react to that question.
True.
And not go for another work session.
Right. Exactly. I think you're right on there, Tom, I think. So does someone have, maybe we'll take a poll. How many of these meetings are at, the one that you mentioned, Samantha, was May 30th?
Yep, the last meeting in May is the 30th, and that's a night meeting.
Okay,
That is Memorial Day, isn't it?
it's the day, it'll be the day after.
They're doing it on Tuesday, the 31st.
I thought they were doing it on the 30th, but Don Sherman is on and so is Supervisor McDonough, so maybe they can let us know.
The meeting will be at, on the 31st that evening, and we do not normally have work sessions on that meeting. It's normally just a business meeting. I mean, that would be, it's not to say that it couldn't be done, but it would have to be after the regular meeting because I have a conflict prior to we have a 5:30 board meeting.
Otherwise, the 23rd, next Monday, would be their regularly scheduled meeting during the day. And then June 6th, the one after that would also be during the day too, in the morning. And I think when we were talking with the Board of Supervisors, we ideally wanted this work session or joint meeting to happen before interviews for the director.
Correct. And the timeline shows that we would be starting interviews on possibly the 13th of June. That's probably it, or the June 20th. And I think it's probably going to be more closer to the June 20th since the day the applications were extended for a week. So it'll probably be the later date. So how many people would be available June 6th at 9 a.m.?
I have it on my calendar, so I can
1, 2,
I would be
3,
available.
4. Okay, we've got 4 then. How about you, Jess? By Zoom?
I am not available June 6th at 9 a.m.
Okay. All right, so, but I think, what do you think? Is June 6th okay to have the meeting then? The joint meeting? Okay.
at 9 or at 10. I had 10 down, but
Well, their work sessions are later. Their meetings start around 8:30. They start with some work sessions and then their actual meetings at 9. And then our work session, I don't know what time our work session will
okay,
be.
well, I'll just leave it.
It'll be sometime,
June
it'll be sometime that morning, probably.
We will try to get you a specific time, Amy, so you can calendar it. Right now, I would guess 9:45.
And then the second question about that, and maybe there should be an ad hoc committee or something on this, but what do you want to present at this meeting? And do you want someone from the county, Ed Raber has offered to help us develop some sort of program if we want to. Samantha, you still have your PowerPoint that has been presented. So that's a thought too, that we might want to present something. Does anyone feel strongly about that?
Do you feel like we need to present something that's in response to Supervisor Wickham's questions specifically?
Yes, I think we should somehow be prepared to answer those questions. I don't know the answers to those, so that's not me. I don't know who it would be.
Might I make a suggestion?
Yeah,
So it appears to be budget related questions. Stella Rundy is the county budget director. So reaching out and having a conversation with Stella, she was at the meeting, Sandra, and she may, knowing Supervisor Wickham, she may know what he's after. And she could have some conversation with him too, to be sure that, the Board of Health is answering his specific questions.
that's a good idea.
I wonder too, if we should pull together the data that we got from the counties we interviewed back in the winter. So I did Lynn County. I can get that pulled together. And because I think that would be important too, to show what their staffing and budget is
Yeah,
or are.
I don't recall that I had any specific interviews, but I did gather data on the staffing levels,
Mhm.
and I've got that.
Yeah.
I would also suggest including Stacy with VNA and having some sort of list of the staff that are currently there and the things that they're working on. And you have those conversations about adding new staff.
Well, and one of the questions too, Sanders, I recall, was just, there's going to need to be a deep dive into the amount of the grants that the VNA writes for us and that they're passed through. Again, that would be Stella Rundy she would be your key resource for that. And honestly, we can only know what we would know. Samantha, I'm sure you could present a spreadsheet, but because of the change in personnel, I don't know that we're going to be able to answer every question. If they want to go deep into the contracts, that would have to be something that Stacy Killian would answer those questions.
So Samantha, when you mentioned Stacy Killian, were you thinking that she would be present at the meeting?
I think that would be the most helpful.
Okay. Consider yourself invited, Stacy.
I'll be there.
And Samantha, do you have any other ideas or any thoughts about how we should approach this?
Like Supervisor McDonough said, I think it's a budget thing. So maybe we can look at what our budget has looked like the past few years and what our future plans are for that. And then also something I've talked about with Stacy is the deficit funding, looking deeper into that and what services are being paid for through that funding source would probably be something important to talk about at this work session.
All right. And I'm certainly willing to assist with the preparation of anything. But do you kind of want to take, Samantha, do you want to take the reins?
Sure.
Okay, is everyone okay with that?
I'm okay with that. I guess the only question I'd ask is, does this group, and this group, I guess, is the entire Board of Health, need to visit once before we have this meeting? Do we need to go have a special meeting to agree as a board?
I imagine so.
It might not be a bad idea.
Right, right.
Yeah.
We're going to be having lots of meetings in June. Just heads up, guys. But yes, when would you like to do that meeting? So Samantha will kind of get it all organized and I'll help in any way I can. And then when do you think that meeting should be, Samantha?
I think if we are meeting on June 6th, we would want it to be no later than June 1st that we meet, so that we can still get any forms or documents in the agenda packet for the supervisors.
Yeah, because I'll be unavailable June 2nd through until the 6th.
Oh, okay.
Okay,
Be out of town.
well, let's schedule it then. Let's schedule it for June 1st. And what time, like in the afternoon, something like that? Or 4:30 like we usually do? Do you have a preference?
That's fine with me.
Yeah.
4:30.
Yeah, okay.
Hendrik Schultz has joined too. So I don't know if he'd be available or if he has an idea on what time.
Yeah, let me just check real quick. Sorry, you said June 1st. That's the Wednesday. What time did you have in mind?
4:30.
5 would work better if that would work for everybody else.
5 p.m.
5 p.m.
That's fine.
Thank you, appreciate that. I put it in right away.
Okay, and so that will be a special Board of Health meeting to finalize what we will present to the supervisors
Yep.
on June 6th around 9 a.m. So, okay, go ahead.
No, at least that way the entire board is behind what's being
Right, right.
presented.
Right, and that's how it
The
should be.
majority of the board, anyway.
Yes. I was a little remiss when I started talking about the work session last Monday. I really appreciate Dr. Schultz's letter that he sent to the supervisors, and they found it very helpful. And also Amy Crow-Sunleaf spoke on Zoom, and I very much appreciated that. And so that was good. And really, there is general consensus among the supervisors to increase our staff. They just don't know how to do it quite yet. I mean, they just haven't decided how to do that. So the second thing I wanted to talk about was the hiring of the clerk for our department. That position was posted and there have been some applications. and some interviewing is going to take place. And our governing body bylaws state that the county health director to employ such other staff for positions which have been authorized by the board to realize the purposes of the agency. So the county health director is the one that would be doing the interviewing and hiring of the clerk. And so that will be, I guess, I have a question. Do you guys agree that it would be Samantha, the interim director, under our bylaws that would do the hiring of this position, the clerk position?
That's what it sounds like through the bylaws.
Yep.
All right. She has invited any board member who would like to attend. There's going to be an interview when? Samantha?
Tomorrow at 3:30.
And if there is a board member or board members who would like to be there, as long as they're 3 or less, they could be there. I don't plan to attend myself. But just let Samantha know if you would like to attend tomorrow for the
Do you
interview.
want someone there, Samantha?
I'm good with whatever, either way.
Yeah,
I can be there.
yeah, I won't be able, sorry.
Yeah, I don't like to overwhelm a candidate by putting
I know.
too many people on the other side of the bench. So
Right, right.
I think if Amy's available and Samantha.
And how many, will there be 2 people to interview or how many?
2.
2, and will they all be tomorrow or?
No, the second one hasn't been set up yet,
Okay.
so I can keep you updated.
Okay, all right. And those applications have closed, I take it?
Yes.
Okay, all right. All right, and so this bylaw, just keep in mind that when we hire our new county health director, this bylaw will continue to stay in place. And so we won't have to do the other hiring. So that's good. We will hire a good director and they'll take over that job. So the next thing I wanted to talk about was a little bit about the executive director position updates, the recruitment. Just call your attention again to the timeline. May 13th was the deadline for applications, and the ad hoc committee of 3 was asked around, it was that week, I think, whether we would agree to extend that for 1 week just to catch any late comers. And so we did approve that. So the actual deadline for applications was extended to May 20th. Around May 6th or so, we got a report from our recruiter, and at that point, there had been several applications that met the minimum requirements. From May 16th to June 3rd, there's going to be consultant reviews, resumes, interviews of candidates, background reviews, due diligence, etc. So the consultant does all of that. Once the reference checks are conducted, the consultant will narrow the field to 6 to 10 candidates for further consideration. And then I guess once that is down to that amount of people, the consultant will want somebody from the board or the board to review the applications at that point and whittle them down even farther. I think that's how I understood it.
Well, in our question, Jess and Sandra, and my question was, do we want the full board to do that? Or when we were appointed to this committee, was that what our task was, to whittle it down? So that, I think, is
That's kind of the question. Does anyone have any comments about that? So we're going to get a pile of applications, maybe 10 or 12, and we will need to call those basically down to about 6 or more if we want.
I thought 3 or 4.
3 or 4. It might even be less. Yeah. But we do have to call them down at that point. So the question was, and that will be happening coming up, from May 16th to June 3rd. So does anyone have any thoughts about that?
Well, to generate a formal discussion, I guess I'd make the motion that we let the ad hoc committee do the first sort of applicants.
Is there a second to that?
I'll
Yep.
second.
Okay, it's been moved and seconded that we have the ad hoc committee, which consists of Amy Crow Sunleaf, Jessica Smith, and Sandra Larson, to do the first culling of the applicants. And so, any more discussion on that? Hearing none, let's take a vote. All those in favor of the motion say aye.
I,
Those opposed say nay. Okay, that passes. So then the ad hoc committee will do the first reduction of applications that are presented to us by the recruiter. Then we need to set some dates, get some dates in place for interviews. The first set of interviews will be virtual. And we can all be there. And we're looking at the week of June 20th for virtual interviews. And Amy, did you get any, I mean, we'll be interviewing 3 or 4 people, so it's going to take like hours, I would say, probably a couple hours at least. So the week of June 20th, maybe we should pick out a couple of dates when we think we could be present. I guess there's a question, does everyone on the board want to be present for the interviews? Just
If-
take that, yeah,
if possible, yes, yeah.
okay, all right,
Yeah, I think as a board member, we have an obligation.
okay. So let's pick a couple of days, that week of the 20th. Let's start with Monday, the 20th.
And we talked about doing these at night too,
Mhm.
a little bit. And we haven't talked with the consultant about that, but,
Yeah.
So I don't know if we can really
If that's
define a
the-
time yet, but
Yeah.
we could pick a day.
Yeah. I would pick a couple of days during that week and a couple of times, because we
Mhm.
don't know when the recruiter will be available and we don't know when
Mhm.
the applicants will be available. So why doesn't someone just, is there a motion to pick a couple of days that week? And then we'll just vote on it.
I know I would not be available on the 22nd.
Okay,
Yeah, me neither. That unless just from 3 to 5.
Does the 21st and 23rd work?
21st from 8 to 11, 1 to 2, and then after 4.
You know, if the recruiter approves of and can arrange night interviews or evening interviews, that opens up my calendar wide open, yeah.
Mhm.
So,
okay. So why don't we say like on the 21st, 6:30? And then on the 23rd, same time? Or is that too late? I actually don't know how long these interviews will take, so. Maybe we should say 6 o'clock.
6 o'clock.
Yeah.
6 would work, yeah.
Okay. So then the tentative dates for virtual interviews that we can at least give will be the 21st of June at 6 o'clock and the 23rd of June at 6 o'clock. And then after we have our next meeting with the recruiter, we'll be able to pin that down and then let the board know which
And-
date that will be.
It should be noted that we will go into closed session to do these.
Right. It'll be a special meeting, but it will then go into closed session for the interviews.
Is our take that just if some board members are not able to be there, we just proceed?
Yes, we won't be, there wouldn't be action taken during that meeting, I don't believe, so.
So theoretically, if we didn't have a quorum, we could still proceed.
Yes, I believe so, yeah. We can, I'll double check that with
Yeah.
a couple people from the county, but I think that's true.
Dawn's on, she could probably tell us.
Dawn?
Yep, if you don't have a quorum, you're not meeting, so it would not be open to the public, but we would post it with the language under Iowa code that allows you to go into closed session to review a candidate's application and do an interview. And we've done that in the past at the Board of Supervisors level. So either way, you're not going to take any action. Only action can be taken during an open session. And the decision you'll have is making the appointment in open session.
And so if there wasn't a quorum, we call a special meeting, but there's no quorum, we could still go forward with the interviews.
Yep, it'd be similar to your subcommittee meetings.
Okay, all right.
Okay.
Okay, and then we need to set a couple of dates the week of June 26th. And these will be for in-person interviews. I think, and I'm not absolutely sure on this, but I think the virtual interviews, will there be more breaking down at that point? Like, let's say we do virtual interviews of 4 or 5 people, and then in-person interviews of less than that, I
I
think.
think 2 or 3,
Yeah.
right? Yeah.
Okay,
And then in that second round is when we will invite stakeholders from the community and county
okay.
to do a panel.
That second week, the week
Yeah.
after.
Okay.
Yes, so far, yeah, days look 27th, 29th look good. Tuesday just the morning.
The in-person interviews, I think we're going to be during the day.
Yep.
Yeah.
Yeah.
So
would
my
make sense if,
my Tuesday and Wednesday look bad that week, the 29th. But I could perhaps make them work with this much advanced warning.
Okay. How about the 30th? Does anyone have conflicts on the 30th?
I have significant conflicts on the 30th. I'm good on Monday. So,
That is the start of a long weekend too, so that might,
So
July
the
1st.
27th works for you, Jess?
it does. Monday, the 27th does work for me, yes.
Let's choose the 27th of that week. And again, that's daytime, so for now, let's just put 2 p.m. I have no idea. We'll have to get that clarified, but. And then I would choose a second date for the next week after the 4th of July. Just in case. So the 4th is a Monday. So I would probably stay away from the 5th. So 6th or 7th, how does July 6th and 7th look for people? Right?
I would request the 7th as opposed to the 6th if possible.
Okay. All right, let's do the 7th again at 2 p.m. And then we'll get the date or the time clarified, but at least that way we have it kind of on our calendars so that it
Okay.
won't be us slowing things down, so.
Did we say 7th
We
tentatively?
said Thursday, July 7th.
Okay, tentatively 2 o'clock. Okay,
Yes, yes.
2 o'clock, and what time, did you say 2 o'clock for the 27th also?
I did
Okay.
to be, but really it's to
Yeah,
be
to be
determined.
confirmed, yeah.
Okay, and then the last thing I wanted to talk about, we have a list of potential invitees for the panel discussion or panel interviews. But we have way too many. We have more than what the recruiter thinks we should have for the panel. So we had a discussion, the ad hoc committee had a discussion about leaving that up to Samantha to make the decision about, I think the recruiter says 6 to at the most 10 people, but she really wants it only about 6 people to be the invitees, so.
I think our feedback was that it would be most helpful if Samantha could identify the stakeholders that she most routinely works with, and then we could pick from that.
Correct. Thank you, Jess.
And
Makes
I would
sense.
think at that meeting, we could probably do with less board members, because the board members have already,
We're not
And a
in that
voice.
panel. with-
oh, we're not in
No.
that.
It's a separate interview.
I don't think we'll be in that panel now. Another county recorded those discussions so that the board could look at it later if they wanted to. So I think that's a good idea. So. But then none of us would have to be there though. Okay, that's the end of my announcements. Next on the agenda is the Board of Supervisors, Board of Health Liaison Comments. Supervisor McDonough?
Yes, thank you.
Okay.
So the presentation to the Board of Supervisors on Monday, Sandra did a great job and Samantha did as well. And Dr. Schultz, I do think your email letter was important. Amy, I appreciate you being there. I had invited Samantha and Sandra to come because we've been awarding ARPA grants. You've been probably seeing them in the paper. And I wanted us to be present again. I know there've been some questions on Zoom and some emails from some members of the Board of Health about, the status of your ARPA application. So just trying to be present, that can make a difference. And also I wanted the Board of Supervisors to know about the different workload, the sanitarians workload that Bailey is doing. I don't know that the board had been ever really made fully apprised about that. And of course, that Samantha sadly is leaving, although excitingly getting a PhD. So that's good news, bad news, certainly happy for her. So that I think was the reason to give an update more than a COVID update, was just to be present and to say, we're getting questions. We have people on the Board of Health wondering what the status is of the ARPA application. I think that Stella can help you put together the information that you will know. None of you are directors with lengthy experience. I wouldn't expect Samantha as the interim director to be completely fluent on how the grant funding has happened. Tom, I think you carried that when you presented your budget information, you carried the historical context as best you could about the various grants. If you go back to January, right, when we were there for a budget presentation. So, and if Stacy can be present, that's all good. Obviously, I think the funding for any staff members is going to have to come out of the county's general budget. The ARPA funding is only going to be for short term. And so it's not, I don't think, inappropriate to preview what the budget request is going to look like. Obviously, these folks, hiring people costs money. And I think, you might even, my suggestion might be to have citizen input, just as the citizens that you are, highly skilled in the health field, to say kind of what was in Dr. Schultz's letter. Even there's an expectation that we would come out of this pandemic understanding better what the Board of Health's task is, and to not be so lean in the future, in addition to other issues that are health related issues that we need help with as well. So I think the ARPA question can be there, but I think that, I'm certainly advocating that we make the decisions we need to make to hire the people slowly over time, but several, to get the department to a position where we feel that it's returning to capable and then beyond, right? So as the county grows and our smaller communities aren't so small anymore, think of Dyersville and the national press and Cascade and Farley. I mean, the county population outside of the city of Dubuque is growing, and none of those cities have health departments. That's all on county health as well. So I think that that's a good reason to be there. The other thing I guess I would just maybe make a note to everyone is that we have a Mercy One medication assisted treatment program for Mercy One Turning Point, the MAT grant. And when the supervisors initially made that grant, and then it runs, or at least it did run through your budget, that program was not in no other provider had a medication-assisted treatment program regarding opioid misuse, right? So now Crescent Health Center also has federal funding for MAT. And yesterday, Hillcrest told me they do as well. So it seems that there might not be that same need at the county level for us to be supporting Mercy One and Turning Point that was intended to be gap funding until another grant source was found. So just, I guess, a point of information there as well. I appreciate what everyone is doing. It's far, far beyond a volunteer board commitment. And I understand that, and I am grateful on behalf of the Board of Supervisors, but personally, I greatly appreciate you lending your skill and professional talents to recovery from the pandemic and our staffing issues. I value all of you. I don't know where we would be if we didn't have this Board of Health. So thank you.
Thank you, Supervisor. That was helpful, kind of know what direction to go. The next item on the agenda is the approval of the agenda. Is there a motion?
I make a motion.
Thank you. Is there a second?
I'll second.
Any discussion? All those in favor of approving the agenda, say aye.
Aye.
Those opposed? Okay, that passes. The next thing is the approval of the minutes. Is there a motion to approve the minutes?
I move to approve the minutes.
Second?
I-
Any discussion? Hearing no discussion, let's take a vote. All those in favor of approving the minutes, say aye.
I
Aye. Those opposed? Okay, the minutes are approved. The April 20th, 2022 minutes. Next, presentations and reports. First, response to public comment questions from previous meeting. There were none, and none since the meeting. The next is a guest presentation by Vicki Gassman, Maternal and Child Health and Doula Project.
Hello.
Hi, welcome.
Thank you for having me today. So my name is Vicki Gassman. I am the Maternal Child Adolescent Health Coordinator and Tobacco Prevention Coordinator. I also dabble a little bit in health equity and inclusion within Unity Point Systems. So I thought this is a great opportunity to share with you what our maternal health program is, what we're doing with health equity and diversity, and then share with you some of the challenges that we've come across with the maternal health program just as a whole, and some strategies we've used to combat some of those challenges along the way. But it's important to understand what our maternal health program is at the VNA. So we are a Title V agency. So what that means is we're gap filling services. So we, as the maternal health program, do cover 6 counties at this time. We cover Allamakee, Clayton, Delaware, Dubuque, Howard, and Winneshiek. Within our child health grant, we add additional counties such as Chickasaw and Fayette. So we still will meet up with women in those counties for things like oral health services through WIC program, but we have a very robust referral program for maternal health to those counties. So there's no delay in services across the board. What we want to do is we meet with clients, preferably every trimester, because a lot happens when you first find out you're pregnant to actually having that delivery and that family and so forth. So we want to make sure that we're checking in with our moms and dads and supports and siblings, whoever that might be, each trimester. That might mean a phone call. It might mean a clinic visit or a home visit, whatever that client is comfortable with. And the nice thing about our program is we're not limited by an appointment time. So we set up an appointment, say 1 o'clock, and if that appointment goes till 2 o'clock, 2:30, 3 o'clock, we're okay with that. Because what we find is that families have layers. And we want to make sure that when the mom comes in, that she gets all of her questions answered as she needs. We do offer breastfeeding support. for our moms, as well as having some additional subcontracts with our health equity and inclusion work with Black African-American doulas. So we currently have 5 certified doulas that are Black ethnicity that are certified through the state of Iowa that we can connect our moms with. And we're also employed with a Marshallese community connector. So these are kind of all the components that we use, as well as our nursing staff, social worker, care coordinators, data entry staff, and then a lot of partnerships along the way between like WIC, Clarity Clinic, birthing centers, anyone that sees moms that are of birthing age or planning on it, or also that postpartum time. So the services that we offer, quite a range, because in each county, it's different. The majority of these services are mainly offered in Dubuque, but we will extend elsewhere as needed. So we complement what the OB doctors are doing. We don't replace the OB doctors. We are really that social emotional piece, looking at that next layer. We do communicate with the OB doctors with patient consent, so that we can really look at the family as a whole, and that mom doesn't have to repeat herself. We already know what's happening and what's going on. The main thing we do is make sure that mom at that first visit has insurance, understands the insurance, understands the difference between the MCO, between Amerigroup, Iowa Total Care, the Delta Dental, the MCNA, and what does her insurance cover? That's another layer to that as well. If they don't have insurance, we'll do a presumptive eligibility and then walk her through that process in order to find that medical home. And then during those visits, we are doing several different types of assessments to look at the whole person, anything from depression screenings to alcohol. We do listening visits for just assessing some of that, where are you at with your brain health currently. We do a lot of education, health education, safe sleep education, car seat safety, nutrition. We do have a social worker visit as well as a home visit program, tobacco cessation, but also that education about those e-cigarettes, vaping pens, and now we have a new synthetic nicotine that's coming on the market. So that's a whole nother day that we can chat about that. But it's education, knowing what's out there. And then doing those referrals and encouraging that quick process, not only with mom, but also with those in her family. And we've had some success with those referrals. And then our oral health hygienist will also do a quick look-see in mom's mouth, and if needed, assist with that next step of getting that oral health care, because we know that proper oral hygiene is directly linked to a successful outcome with baby. So what we're trying to do is make sure that we have successful births. All of our hospitals are right now working on having more vaginal births versus cesarean. It's just safer for mom and baby overall. They want to increase breastfeeding. As we know, the stats that breastfeeding is best, but it's okay. However you choose to feed your baby, we'll support you with that. We also want to see moms to prenatal care earlier so that we can identify that high risk, so that we can make sure mom's set up so that she knows education, supplies in the home, whatever that might be. And that ranges anything from referrals to food programs to we connected a few with NICC, and now they're going through NICC classes now, and that they'll graduate with an AA, very soon. We're helping them find childcare, all those different layers. So we're really an important piece to the puzzle, and we can spend that time. Not only do we see them then for maternal health, but then they often continue following as child health. So then we're doing developmental screenings on the infant, and we're following mom through postpartum. And we're just keeping an eye on things as they go, really developing those relationships with the kids. It's ironic, I've been here and now I'm doing presentations and education in the preschools, and the kids are like, I've seen you, I know where you're at. I'm like, yeah, I talked to your mom, it's all right. So it's a lot of fun just building those relationships. But as we get going with all of our services, it's challenging to manage and make sure that everyone gets what they need. But what we're finding just as a whole, there's challenges to obtaining care in our county. And that is a number of different things. different reasons. Each one has its own breakdown, but I just wanted to give you a general overview of what we're seeing over the past year of care and challenges that our families are facing. Understanding insurance. Just understanding, what does your insurance cover? They don't realize that it does cover cleanings for dental visits every 6 months. They don't realize it also covers pharmacy visits or brain health for counseling. They're not sure where to go for healthcare. If a mom has private insurance, she still can qualify for Medicaid. But if you don't have the right combination of private and Medicaid, you will not be seen in Dubuque County. For instance, we know that there are places to go in town for uninsured women. That would be Mercy Maternal Health, and they do work with us on getting moms in, although it's limited for the times of day or days of the month that we're able to get our moms there. But then transportation is also part of that issue. If a mom has been assigned to AmeriGroup, they will be at Mercy. If they are assigned to Iowa Total Care, they will go to Dubuque OB for their care. Medical Associates has an obstetrics department as well. They do take private insurance, as well as Dubuque OB takes private insurance. So we had an instance where a mom came in and she had United as a private healthcare insurance. So that meant that she could go to the Dubuque OB range. However, she had AmeriGroup as the MCO. Well, we couldn't cross over. So she ended up having to drive to Iowa City for her care. And that's something that, you know, if we could have seen that earlier, found that out earlier, we maybe could have gotten it changed from AmeriGroup to Iowa Total Care, but that's a delay as well. So there's some challenges there if you don't have the right combo, or if you have one or the other, but you really preferred a doctor or two. It's challenging just to know when and how and where to go. We do have people that come to us that are just simply not eligible for Medicaid due to their immigration status, or they make too much money or something like that. So we need to just look at how can we best serve those clients. We can do a presumptive that only covers a very short time for like things like ultrasounds around 20 weeks, but then that drops off. And then there's nowhere in between that and delivery. Or they'll have to drive to Iowa City and it would be out of pocket, or they'll have to do like a 3-day emergency care in Iowa City for that treatment plan. Accessing care is difficult. There's not enough providers in any of the counties for any of the services, from anything from dental to brain health to medical. It can be a significant wait to get in, and that's just nearly every service, but our OB patients, we are seeing that happening as well. We worked with a patient that we're trying to get her into care as of March 11th. She finally was assigned an MCO on April 30th, got her into a doctor on May 16th, and she delivered, May 15th, and she delivered on the 16th. Could we have gotten her into care 6 weeks earlier? We were trying, you know, but that's just an example of the struggles that we have, and it's very important. I mean, we're looking at health of mom and baby as well. We know that we've got many coming into the community and going out of the community. So just to find a nice path for them so that they can navigate where to go and how to go, and encourage them, stop down at the BNA, we can assist. We can walk you through what are your options. If you want to go this track or this track, who would you like to have? We're able to walk them through so that they do have choice and they can assist or have that decision in their hands as they're going, rather than just showing up at the emergency room for delivery, which we have seen. Transportation is always out there getting to and from places, but not only transportation, but childcare. Who's going to watch my other children while I go in for an appointment? And then finding that childcare after birth. Interpretation is something that we struggle with as well. We use language line as much as we can, but finding persons who are able to dual language and then know that they know what they're talking about. You know, we have to trust that. And the high-risk patients is another challenge. So not only like if mom has a chronic illness or we have a developmental thing going on with baby, will they be referred to Iowa City and not seen anywhere locally? But a certain BMI as well. Providers will not see a mom if she has a higher BMI. So now we have a mom with high risk who can't even see anybody locally if there's an issue. She now has to try to find transportation and childcare to an hour and a half or 2 hour away and hope that she can get an appointment. So that's just a quick breakdown of what we've seen, challenges to care, what our patients are telling us, and what we're experiencing on a daily basis. But what are we doing about it? So we wanted to just see what do we look like from January and the first 4 months of 2021 versus 2022, because I wanted to see what does our clientele look like? Are we changing the ethnicities, the races? Where are we at? We have we're doubled, a little bit more than double with our number of clients that we're serving. So that's good. We want to continue with that, but that also shows that there is a need in our area for what we do. Our community in general is primarily white, so it's no surprise that white race is around 75%, 73% for the two. But looking at the Black African American and Pacific Islander statistics there, we went from a 6.4% of Black African American of our clients and nearly doubled that to 11.48%. We also had our Pacific Islanders at 6.41% and increased that by 8.2%. So we're starting to reach some target populations where we're seeing higher social economic issues happening. Social determinants of health are among African American, Hispanic, and Marshallese as those three. So just to give you kind of an idea there. Then we looked at ethnicity. There's not a lot of change here. We started tracking them a little bit differently. We really were trying to find what are the ethnicities out there and fill in the gaps. So we had a lot of nones or declines in the past or others, and we tried to really figure out where do those things lie. So not a lot of change as far as from not Hispanic. In fact, we see a little bit more not Hispanic at this time, a year later. Go ahead. Interpreters needed. We are seeing about the same as far as people saying that an interpreter is needed. Some of them mark no, but they'll bring their own family member for that interpreter because they don't want us to use a language line. So we do track it. I don't know. I think we could probably do a little bit better as far as really tapering down if they bring their own or if it's a language line kind of thing that we're looking at. So then I was like, oh, let's look at language. And we are actually adding languages to our needs. So we now have this year, we're looking at English, Spanish, Marshallese, Burmese, and Somali as far as those languages that are out there that we're seeing more and more people identifying that, if they had the opportunity, they prefer to hear the services in their own languages. So we're watching that as well. We do know that African-American ethnicities are 6 times more likely to have an unfavorable outcome with their pregnancy. And that could mean for mom or that could mean for baby as far as mortality goes. So Iowa Department of Public Health has offered us one of 4 counties in the state of Iowa. So it's Blackhawk, Polk, Scott, and Dubuque as their 4 chosen counties for this pilot year. And we are focusing on African-American ethnicity, Medicaid eligible, and then need to live in one of those 4 counties. And what we're trying to do then, and go ahead with the next thing, is improve their overall outcomes by using a health equity lens. Just in general, you're more likely to build that relationship faster with someone who has lived experience just like you, or looks like you, or has a commonality with you. So what we want to do then is match up African-American as a mom with another African-American mom and let them build that relationship. And it's one less barrier along the way. As much as I open our doors and assist and understand culture, there's still that that barrier or that wall that can still be present. It can take longer to build that relationship. And in some of these cases, we don't have longer. We really need to step on it. We want to increase prenatal care because for African-American women, only 68% will seek prenatal care in their first trimester versus their 87% white counterparts. Many times we're seeing African-American come at week 37 or 38 because they may be having pains or think they're in labor, and then they present at a delivery from there. And then we also want to increase breastfeeding among African-American moms. They're 69% of African-American Black families breastfeed versus, oh, I have a typo, sorry, 84% of their white counterparts. So we want to switch that up. So this doula project, what is a doula? It's really a support person, a companion. And the best way I can really describe it is like your new best friend. They're there for your support. They'll help you with cleaning. They'll help you with understanding. You can let it lay out there. There's no judgment. She's there for the mom and to help her understand that of the care that's out there, be that emotional support, help support people in her life understand the next stages, what's going on. She can give advice on how to support mom for the best outcomes and decrease that depression and things like that. They don't deliver the babies. However, they do assist with the understanding of the process. What is your body going through? How can we get you to the next piece and develop that birth plan and help her get through that birth plan a little bit easier. So we do there's 3 parts to the doula program: prenatal, birthing, and postpartum. And these visits could be virtual, FaceTime, or they could be in person. Currently, we are seeking African-American women who live in Dubuque County that would like to be certified. We can assist and pay for that process because currently the most local doula I have is in Scott County. So would love to identify some champions more locally. Our Scott County girls are wonderful. They're willing to drive up and still service. And actually we've done a great job with working with the Dubuque County that IDPH has offered for us to also admin Scott County as well. So we're assisting with that, which makes a nice transition with that care, and our doulas get to know us really well. So prenatal, the doula will be available during birth, and then the doula will meet with them postpartum as well. As I said, they don't give medical advice. They do not make decisions for the client, but they do help the client understand the decisions that are made. If you go this way, these are outcomes here. If you go this way, these are outcomes here. They do not take the place of the partner or offer personal opinions or perform any medical task. Again, it's just helping them understand what's up and coming, what's next. Research has reported that the doula care is high value model. The doulas do support families during pregnancy, birth, post birth. They do reduce cesarean deliveries, prematurity, and illnesses in newborns. They also reduce the likelihood of postpartum depression. So research has told us this. Families who receive this doula care do report an overall satisfaction with experience of childbirth care and increased breastfeeding and the duration of that breastfeeding. We're looking at health equity and diversity with this program specifically. And what we're doing is we know that there are disparities in healthcare when it comes to African-American women across the state. And that's why many don't choose to go to an OB provider. They're afraid of past experiences or things. So we as an agency have met with some birthing centers here and providers, and we're bridging that gap. We've had our doulas meet with providers. We're getting to know each other so that it's not just a shock that, oh, you've got this other person here, what's happening. So we're really trying to bridge that gap and just be that person, that let's ask the questions, let's talk about the hard stuff and for the best outcomes for our families, because we're all in this together. This is just a statement from the initial proposal from IDPH. And it basically says that finding a doctor that looks like you will assist you better. It just makes you feel a little bit more comfortable with that building that relationship. They understand that diversity and really can move forward with care a little bit easier. Somebody who looks like you and has been through it like you can understand what you've been through. So that was some of the premise from this project. Our Marshallese Connector is another way that we are trying to combat some of these challenges. And again, somebody that looks like you and knows your culture may be able to kind of have those tougher conversations a little bit earlier in those relationships. So our connector, Nikki, attends appointments. She connects with families. She does insurance. We've done funeral expenses for people, housing. We've done education nights. We've translated materials. And so that's part of how we're seeing that increase in our Marshallese population, just within maternal health, but honestly, overall with our entire agency. So that's been a successful model, and I would love to take that model and increase that to other populations as well as funding works out and whatnot. We have done a sleep education night in the past. This was a tough one because Marshallese families, they co-sleep. They sleep many in a bed, sometimes not a bed. They feel that they pile things on. They're from the islands, so they're cold. It's Midwest, so they layer and layer and layer. They often don't have car seats. They don't have cribs for babies or anything. So it was, we were worried about how do we bridge that gap between our Midwestern culture to their culture as Marshallese. How do we tell them, we understand what you've been doing, but it's not safe. We've seen it's not safe. And the night went off without a hitch, and we've now done 3 education nights. The way we approached it was we set up a bed, and you can see in that bottom middle picture of a typical Marshallese bedroom or bed, or space. And Nikki packed the stuff in, and she's like, and we put this here and this here and this here and this here. And as our nurse, Jessie, started going through the PowerPoint and just saying, what times have changed when my kids were little, when my mom's kid, when we were little. And we took it from that perspective of research has shown, we've seen this, we're not here to tell you you're terrible people or terrible parents, but we're here to say what's happening. And as the time went on, we invited the girls as they learned new things. They just kind of got up real slow and they pulled things out of the bed and they handed it to our nurse, and then she helped them. She kept talking, and then they'd hand her another thing. And at the end of the evening, she has all the things that we didn't like in the bed. And then they took that and requested a second training for the churches. And then we were able to supply pack and place to the churches. So at the church now, the kids have a safe place as well. So that's just an example of that bridging that gap and the success that we've had. And because of that success, here's the church, and in their own words, they wrote us a thank you that basically says, thank you very much. I received one of the donations from you guys, the VNA, a pack and play crib to New Hope Family Church. They are beautiful to lay our baby down and very comfortable in it. Thank you, Albini. I would attempt to say their words. All I can say is Komotada, which means thank you, and Yakwe, which means hello. So now you know 2 Marshallese words you can share with others. Again, another mom just wrote us a thank you note. They're very gracious of what they've done for us or what we've done for them, but they also teach us quite a bit as well in the office. And with that, what questions do you have for me?
Does anyone know what the grant is that we pass through us on maternal child? Do we get a grant? No.
No, the maternal and child health grant actually just comes straight to me.
Straight to, so the Board of Health doesn't do any funding for this then, okay. And the having a baby while on Medicaid, does having to travel out of town, does that affect outcomes?
It does. It can delay care. And it can also, moms that are less likely to seek care because of the extra delay. So where they might have a cough or sniffle, think nothing of it, or a headache. A headache's a big one. They just kind of dismiss it or try to self-medicate, where headaches for women who are pregnant can have, they're significant. I see Dr. Hendrick there nodding too. Headaches can really mean something bigger than that. So then they just don't want to go to care. The time then, the length of time getting there, it's a challenge, it's a hindrance, a barrier.
Mickey, you mentioned tobacco cessation. Is that funded through the tobacco cessation that?
So yeah, the tobacco grant is, the Board of Health owns the grant there, and then
Yeah.
we're subcontracted for that.
Okay,
So we
there is
present
that.
all that activities. We're doing the education. We report out to Samantha and work with all those activities, education throughout the county.
So that piece of it.
That piece
does,
of, yeah, and that directly relates because one of the goals of the maternal health grant is reducing that secondhand smoke and reducing moms smoking too. So those work very nicely hand in hand. So.
Okay.
Mhm.
I'm just going to ask how many Black doulas there were in town, but you said 0. So
So-
I'm gonna try and get some contacts. And
Appreciate it.
try and get some, and Pashto might be another language
Oh.
to start. Afghan families are coming to Dubuque, and I think one has been down to the VNA for some shots already, and 2 more at least are coming,
Quite
so.
possibly, sure. I do know that they do yearly trainings to become a certified doula. There's 3 openings for the beginning of June training. So we could, if we move quickly,
Okay,
I would be happy to connect them. Ebony is our she's our main person. She and Jasmine has started the Iowa Black Doula Collective. And they actually paid a national speaker to come to Iowa and train for this.
and they're out of Polk or are they out of Scott County?
So, trick question. Ebony used to live in Scott County. Her husband's job has moved her to Georgia, but she still does all kinds of things and travels back here a couple times a month and does things here. Jasmine is Polk County. And then our other ones that we have 3 right inside Scott County. And the 3 there are newly certified. So what that means is Ebony and Jasmine will oversee the work that the other 3 are doing, just to make sure that everything is in line if they have any questions. But every doula also has a backup. So that way, if one goes into labor and something's happening, we have a backup for mom too, so that there's no delay in care.
So there's no one in Blackhawk County either, just Scott County's?
With Blackhawk, there's, I think, 2 or 3. They're not subcontracted through us at the VNA,
okay,
because
okay.
each one of our agencies has their own subcontracts with specific doulas. I believe they've got 3 in Blackhawk County right
Okay.
now that agency is working with. We always give the doulas the choice of, would you like to subcontract with one county or all, or, whatever fits. Blackhawk is quite a busy county, so they're keeping themselves busy there. So I'm like, oh, Blackhawk, you're only an hour away.
I know.
You could easily make it up here.
Yeah.
But they're quite busy there, and that's understandable.
Mhm.
Yeah, but yeah, if you can identify a
There's not an
champion
age, I mean, just have to be a Black mother.
to participate in the program
No,
or to
be the
become a
doula, yeah,
doula.
is there a minimum age?
I believe it's 18.
Okay.
To be considered, and there's different levels of doulas. There are doulas that are just fertility, that are just prenatal, just birth, just post, and there's also grief doulas as well. So for this program, we may see some expansion within that, and then so that she can kind of choose what she wants to specialize in. And you don't have to be a nurse to do it. You just need to be passionate for helping people. The doula training will teach you what you need to know.
Thank you.
Are doulas paid?
Doulas are paid. They're paid, it's a paid position. They basically own their own business. We as the Title V agency, we're given money from IDPH and then we pay our doulas for the service.
Okay.
And their pricing can range depending on who and what, and if you meet with them more or less often or a longer time frame. The average price for a pregnancy would be anywhere from $2,000 to $4,000 out of pocket. There's been some talk at the state level of putting some proposals together to ask Medicaid to pay for some portion of that, if it's either pre or birth or post, because any little bit could help. Currently, it's not a billable Medicaid service, so I can bill for like some of my nurses' services for the assessment they're doing, the time spent, I can bill for that. But as far as the doula goes, that's straight up out of pocket or a separate funder.
Any other questions? Well, thank you very much, Vicki. That was very informative. Thank you.
Thank you.
Our next agenda item is a guest presentation by Whitney Sanger of the Dubuque County Food Policy Council.
Hello, everyone. I'm Whitney Sanger. I am the new chair for the Dubuque County Food Policy Council. Previously, it was Michaela Freiberger, who did a fantastic job. I am Creative Communications and Development Director for the Hawkeye Area Community Action Program here in the community, and also co-founder of a nonprofit that focuses on food called Project Rooted. So I am very invested in this process, and I'm excited to share what we've accomplished so far as a council. The Dubuque County Food Policy Council was created before COVID with like-minded people who were very passionate about changing our community through food. And that was through many different facets. So we set off on this journey to understand what our community's needs were. And we did that a few different ways. Just like everything though, COVID hit, and we had to alter and pivot a little bit in our process. So this strategic plan is a labor of love by our council. It's something we've been working on for quite some time, and it's accumulation of many different ways that we achieve this data. So we did host prior to COVID, we hosted an in-person strategic planning session. We also did a virtual strategic planning session, and then we did community input and surveys as well. So what I'm going to go through today is the information that we've learned and the data that we've accumulated, and it's what and where we want to go from here as a council and together alongside the County Board of Health. So is anybody not familiar with the Food Policy Council? I know we have a lot of new faces. Okay, awesome. Well, I will share a little bit of our purpose and our mission. But our purpose is to assist Dubuque County in partnering with other government and non-government stakeholders to provide leadership to and coordinate the development of food-related policies and priorities at the regional, state, and national level. We want to foster connections and information sharing between food-related groups. The information sharing between food-related groups is something that you'll see throughout this presentation. Partnerships are everything. We are a volunteer council, which means that we need a lot of help and support from the community and the county as a whole. So we want to improve the health and well-being of residents of Dubuque County by promoting a resilient, just, and equitable food system. And we try to accomplish that in 3 different ways: policy recommendations, educational outreach, and partnerships. So everything in this proposal and executive summary in the strategic plan is based off those principles, which you'll really see. So again, in keeping with the mission of the Dubuque County Food Policy Council and developing the strategic plan, we really took as much community input as we possibly can in all facets related to food. So whether that be institutions, growers, community members, food advocates, those that provide access, especially during COVID, we gathered as much input as we possibly can. So today, after I share a little bit about what our findings are and where we're going from here, we do have a funding request and also a plan for implementation from the County Board of Health that we would like to see. We also have a very strategic way of ensuring that all these principles and actions are met. So we have a really good plan as to how do we measure our success and how do we move forward as a council and how can we achieve these goals as well. We really wanted to break it down into three different planning principles: easily accessible, inclusive communication, healthy, appropriate foods, and sustainability focus. So again, everything that you see throughout this strategic plan will incorporate those three initiatives and principles. So we broke this down into three priorities to make it easily digestible. Us as a council, we had a subcommittee that met bi-weekly. We reviewed all the data that we've gathered over the couple of years that we've been doing this, and we put it into actionable items and also labeled the priorities as to what that meant to us and what it looked like in the community. So the first priority is foster a local food economy, support increased local food production, distribution, and employment. So we really want to improve the vitality of both rural and urban communities in many ways. And this may be growing, processing, and distributing local food, because we know it enhances the overall economic resiliency and really helps us expand those community-based jobs and promote health and create a resilient, sustainable, and equitable food system. And I think this was one of the areas that we realized most during COVID. If you look back at the beginning of COVID, one of the issues that our community had is an understanding of who could process a lot of the meat that we had sitting. And we were trying to figure that out as a community and provide those resources when that could have really been put to good use. Also growing your own food. There was a lot of families that were reaching out, trying to find the resources of, hey, you know, we're home. We're here together as a family. How can we grow and what resources do I have to, one, even understand how do I grow my own food? What are the restrictions to growing my own food? And how can I get support in this facet as well? So this really focuses on that. One of the action steps that we want to take, and I'll kind of go through them, and if you have any questions, feel free to stop me at any time. I want this to be an open conversation, so you can interrupt anytime. We really want to develop a food resource website and interactive map. So this includes retailers who sell local products, chefs and restaurants who use local produce, institutions who regularly purchase local produce, local food producers, certified commercial kitchens available for rent, commercial cooler space available for rent, and also a list of processing facilities. We feel like these resources would be a huge asset to the community, the producers alone. It would encourage other producers to come onto the market if they have an understanding of, if I grow this food, where can I take it? How can I support the community through this food, and how can I also support myself? So we want to be that single resource for Dubuque County that addresses all aspects of food-related business startups. So we essentially want to create a playbook. If someone is interested in it, getting in the market a food-related business, so they have a clear understanding. So that could be licensing, food safety, decision-making tools for leasing space, and portable food sales. So food trucks, if someone wanted to start something like that, or someone wanted to be a market vendor, what is the process of that? We also want to develop a collaborative program with IEC Extension, the Master Gardeners, to offer more training and education and support the community and gardens that maybe are vacant or where we have available lots that are underutilized in the community. So we just gave an example to Mowing to Monarchs that includes some like best practices. So we really want to provide that resource. One thing we're doing this year that we're super excited about is we want to host an annual farm to table dinner to bring institutional buyers and producers with the goal of showcasing products and building relationships. When you think about food and community, it's really gathering around the table. It's something that we all have missed greatly, especially with COVID. But when you meet these growers and producers face to face, and when the institutions come together, you can have those real organic conversations around food. So we're going to be releasing information for our first this year, and tickets will go on sale, but it's going to be at Heritage Trail.
So this farm to table isn't necessarily for people in neighborhoods who are food insecure.
This one isn't specifically. This one is to really bring the producers and the individuals together. However, it will support a food-related initiative with the proceeds. I know like for the Rooted Table, that is a different event. So just knowing that this was created a little bit different to fill a different need. So the Rooted Table is an event that was free to the community this past year. We had 400 participants, and that was a farm to table dinner that we did down in the Bee Branch, and anybody was welcome to attend that for free. And we first opened those tickets up to individuals through our nonprofits. So they had the first opportunity to register for that, and then it was open to the remaining community. And we had conversation based around resiliency at the table. So we had facilitators, we had conversation, and it was local foods as well. So this just fits a different need, and it's also a celebration of community and food as well. I should also state, and this is one very important part that I forgot to mention, is we have had two individuals. We have had Candace Daly and then also Danielle Stoll, who have helped walk us through this. So they are our contracted vendors that have helped guide us through the strategic planning session. And we couldn't have done it without them because this was a lot of work and effort from all of us. So we're very fortunate that we had them through this process. Danielle is actually leading the charge for the Farm to Table dinner, and I know she's really excited to share what this event is about and what it's going to do for the community. But it's really about that creating a vibrancy around food.
Do you know when that's scheduled to be yet or not? The Farm to Table?
Summer solstice. We really want to review existing co-working spaces for expansion to include rentable kitchens. So this has been something that, and just speaking with organizations like Convivium, that they're working to expand this, a place where people can understand what it is to cook their own food in the process and what it takes to sell it. So whether that be canning or freezing or selling something at the market and having a kitchen and co-working space to be able to do that. But also for education as well. We've seen a real need for food education within the community. We're very fortunate that we do have spaces like that. Sometimes it's just the knowledge of where are those spaces and how do I find those locations that I can utilize. So having a one kind of stop shop where they can go and find where they can do, where they can go to fit their needs. We want to be able to provide friendly codes for small rural communities. This seems kind of like a silly one, but how much more than not, we have a lot of questions, and even for us of, can I have chickens? And if I can have chickens, can they go in my front yard? Can they go in my backyard? Can I have a chicken coop of this size? And just basic questions like that, where it's, where do they go? How do they find that information? How do they find the codes? How do they find the restrictions? And how do they overcome those barriers? I know we had someone from ISU Extension say that it was extremely difficult and he just gave up because he couldn't find the information. So it's just having a location for that, again, a playbook of some sort that we can provide this information and resources to families who want to start initiatives like this. And that might be just information again about livestock. If I want to start a farmer's market, what does that look like in my community? Maybe it's one in Epworth, maybe it's one in Piasta, and continuing to grow that where we can gather around local foods. And then really review county zoning barriers. Are there issues and reasons why families aren't starting up small farms while they're not growing? And just really have an introduction of that small scale food production and understanding of what barriers lie. So really doing the research and digging into what that looks like. Does anybody have any questions about the first priority?
I do again.
Yeah.
So for like number 6, do we have people on your council who are in each of the communities, or is it basically Dubuque outreach, or where?
So
your
like on our
people
council,
located?
you mean?
Mhm.
So our council is made up of a variety of individuals. We have individuals that focus on access.
But I mean, do they live in the communities?
They
that
live
you're
in the
serving?
county, yes. Yep, so that's part of the council is they have to live in the county.
So like when you're talking about Cascade, you have somebody who lives in
We do
Cascade?
not have someone that lives in Cascade, I don't believe. So that's something that we're definitely working on, is expanding our council and ensuring that we have all those areas covered as well. Through this process too, we'll focus on each of our initiatives, will really focus on that outreach. And that's part of the issue that we also have is funding for that outreach, right? And timing and having the staff to do that. So that's what we're requesting through this, is ensuring that we have some of that funding where we can go out in the communities and understand what their needs are too. Our second priority is ensuring healthy food access. I think this is another very big one that we realized during COVID, and especially important to my heart too, but we really want to overcome food insecurities, and that's increasing access to healthy, affordable, and appropriate foods. So 9.4% of Dubuque County residents are food insecure. So this is defined as a lack of access to healthy, culturally appropriate food and can be caused by limited resources, disability, and living in food deserts. So we know that food and health are closely related to poor nutrition, and they heavily correlate. So we saw this a lot during even COVID, right? We were trying to overcome some of those barriers, but health and nutrition was a huge part of that. So we really want to create a healthy and vibrant community as a whole. So if we get in situations like that, we can combat it as best as we possibly can. So these also is a ripple effect, right? We have children that may have behavioral issues and experience trouble learning. We may have negative long-term health and socioeconomic consequences, including some of those higher medical bills. And again, the pandemic really highlighted this need in the community. So some of these action steps include integrate food resources and access into existing countywide urban and rural service hotlines. So having a one resource guide for families that need access to healthy local foods. I know before COVID, Healthy Hometowns started an initiative where they wanted to understand where are all of our food pantries, what are their hours, how can I access them, and how can I reach them, and also how can I volunteer with them. And that initiative, because of COVID, fell through. And so when COVID hit, we realized that we didn't have one resource for families to understand where food accessibility lies. So where do I even go to get a food box? It was a huge barrier. We were very fortunate in our community that Jason Nices from the Community Foundation took initiative on that and started a group that focused on putting all that information together. So expanding on that and building that on that, and coming up with a resource guide and hotline so if families do need support, having a clear understanding of where can I go if I want these foods and what is closest to me as well. We want to also develop and distribute materials for use during food drives to promote the need for healthy local food donations. I always think it's funny growing up as a kid, what did you pull when you had a food drive? Usually something in your pantry that you either weren't going to use or you had too much of. So being very intentional and thoughtful of how are we teaching our community to donate even food? How can we help our food banks ensure that they have the food that they need and that families also want? So really doing that education out in the community, whether it be schools or churches or businesses, so they know if I have a food drive, here are some great foods that families don't typically get and that are healthy for them too. So when we talk about this, we talk really about those healthy, but also local foods too. How can we incorporate more local foods into the community? We also want to support the development of stakeholder groups to address food policies and barriers. And this is the interest and engagement of rural communities, vulnerable and underserved populations, service providers, and food pantries. So again, going out to these areas and understanding in specific location what families' needs are, because every place in the county is essentially going to be different. I don't think we're going to hear the same story in everyone. And the needs are going to be dramatically varied. So really going out and meeting with people, meeting with community leaders, meeting with the families that are there and understanding what food are you lacking, how can we support you, and how can we make change with you.
Whitney, I have a question, and this kind of relates to this. You have the 9.4% of Dubuque County residents are food insecure. And I was talking to someone about the Food Policy Council and food insecurity and things like that. And they asked me, who is food insecure?
And I would have to look up the exact definition that we use for that, but I'd be happy to get it to all of you.
But in our county?
As far as the populations that are?
Are they out in the country? Are they in the city? Are they all over? I mean, do we know?
I honestly don't have the breakdown for that, but I will make a note to definitely get that information to you.
And then if you could kind of finish up your presentation in about 10 minutes.
Yes, you bet.
While we have the lapse in presentation. My daughter Annika, you probably remember as a little kid, she's one of Annie's friends.
Oh.
She is the family resource coordinator for the Dubuque Community School District, and they're just starting a food pantry for the whole district in Lincoln School. So please get into contact with her.
Yeah,
I think she
I will.
contacted you about Project Rooted
Okay.
already, so you should have her contact info. I
Perfect.
just texted her. She's texted me back what her contact info is. If she does before you leave, I will write it down and get it to you before you go. But please work with her too, because she would be a great resource through the Dubuque Community School District.
Yeah, I know even, I mean, through Project Rooted, just speaking for solely that's part of our goal is to ensure that those food pantries have some local foods too, and that kids are learning about what local foods are and what is grown in our community too, so.
And as a third aside,
Yes.
a couple of years ago, this is totally not on your, you wanted rhubarb, and I have a plethora this year, if you're looking for more. I gave a bunch to friends that, it was 2020, so we were all, and so I couldn't help you out because I'd given it all away to friends, but if you're looking for rhubarb right now, let me know in the next couple days.
I
because,
will.
It's starting to go to seed, so.
My mom makes the best strawberry rhubarb dessert, so I collect it and then I give it to her to make.
Well, I think you were doing something with Project Rooted, giving.
Oh, we were.
rhubarb to
Yes, we were doing it in
families.
some of our.
So if you're doing
meals.
that again, let me
Yes,
know.
I
because
will.
do have
I will. I
So continue on.
Yeah, thank you very much. This is already conversations that we've been having, but we really want to work with the Dubuque Community School District and the Westfield School District to really start integrating on a small scale healthy foods into their lunches. We know this is one of the biggest struggles, and a lot of that is funding restrictions that they have and also the dietary restrictions that they have to follow as schools. So really helping them find resources for funding to be able to use some of those local foods. So then also producers have the opportunity to produce enough for our community as well. One of the biggest barriers that we have here is we don't have a food hub. So we don't have a location other than a little bit north of us that growers can take their food to and then be distributed out into the community. So one of the biggest barriers for growers is that lack of transportation, of understanding of how do I get my food from our farm to the institution, and how does that look like for me in pricing, and how does it look like for me in delivery, and what is the quantity? Is it going to be consistent? So that is also one of those initiatives that we would like to grow and expand upon, is having a food hub and a location that growers can do that and institutions can buy from as well. We want to, and I know I have 10 minutes, so I'm gonna breeze through this, and if you have any questions for it, let me know. But we want to be a food resource, so having, again, that website where we have one location for all this information, really developing communication outreach tools. There's been so many even grants that have come on the market that were available to growers, that were available to institutions, especially during COVID, whether it be storage or refrigeration, that many of these individuals just didn't know about because they are in so many different locations that you have to be actively seeking that information out. And we would like to be that resource where we then can push it out to the community, so they know that they can reach out to the Dubuque County Food Policy Council if they need that support, and we have that data for them as well. We want to identify and promote existing emergency food plans. So we work with St. Stephen's Food Bank and kind of analyzing their food plan and how can we help you? How can we better support you? We want to build capacity with pantries and access points and understanding where are we lacking, where are we missing, how can we support you in your community? And then we really want to, again, help those local schools with different things, including staff training. That's a huge issue. They don't have enough staff. They don't have the opportunity to train. So much of the food that they serve within our schools, and it's at no fault to them, is heat and serve in our communities. And a lot of that has to do just with the resources. We have Paul from Green Dubuque, who really has focused on priority number 3, which is minimize food waste. He is a phenomenal resource, and I wish he was here to explain it. Although he probably could not do it in 10 minutes because he is very passionate about that, and we appreciate that. But I'll go ahead and really kind of let you read through this because I know I don't have much time, but imagine all the waste that we have in our community because individuals and institutions just don't know where to go with that food or what their restrictions are. I know I had it with Project Rooted. I had so many times where we had leftover food and it was, what are the rules to donating this food? Who will take it? Where can I go with it? And you think of the huge event centers that we have in the community. We have a Grand River Center. We have all these hotels, we have all these weddings, we have all these events. Where is that food going? Is it going in the trash? So really doing a deep dive into that and how can we help those institutions to reduce that waste? And how can we also increase our composting in the community, whether that be institutionally or individually as well. We just, again, we want to be that resource. So when I talk about that, we really want to be this toolkit and this guide for the entire community. If they have food related questions in any of these areas, that we can be that support for them. So you'll really see that we just want to be a partner. We don't want to duplicate anything. We just want to do it with the individuals in our community. So that's a huge part, again, that partnership. So like I mentioned, we had a purchase of service contract where we hired 2 individuals to help walk us through these items. I have to be fully honest and say we could not do this without them as a volunteer council, but also when you talk about individuals who are in the thick of it, and we're in the thick of it of COVID, most were providing food to the community, whether that be through gardens or access points or working with underserved populations. They were really in the middle of it. So they have been absolutely fantastic in guiding us, but this is something that we would like to see continue and have support in. So we have this is our 5-year plan. It outlays the budget. Each year is a little bit different. Our implementation and work plan is very, very, very direct. So we have action steps that are listed out in order. We have due dates, we have who's responsible for them, we have what success looks like, but I would also, once we finalize this, ask you what success looks like for you as well, and ensuring these action items are complete. But we feel like in order to do this to our best ability, we need continued support. And I know that you are requesting positions, and I don't know if these fall within those positions or time can be allotted to the Food Policy Council. But for example, this is our proposed budget. We are asking for at least 20 hours of support per week in order to move these action items forward, with also the support of the community and the council as a whole. We would like to see 10,000 put aside for that annual farms table event planning, professional development for staff and council members. We know this is really important to be out in the communities and have an understanding of what other communities are doing, whether that be going to conferences, attending seminars, really taking a deep dive into how we can be better as a council and understanding that. And then $12,000 to marketing and outreach. And we really see that as community events and engagement, the creation of that website, having brochures, having advertising, having demonstrations, and also some mileage reimbursement for those that are working on Food Policy Council related initiatives. And then you won't see a very large change, where you won't see a change in FY 2024. That remains, well, it's a little bit higher, I apologize, just because inflation, so we increased that a little bit per hour. And then in FY 2025, that does jump up a little bit. And these additional hours are based on our work plan and the workload that comes with it. So each initiative we laid out in a 5-year plan, what year it's going to happen. And this was one of the heavier years and the harder years of things that we needed to accomplish. And we felt it would take more time to accomplish those things. And then you'll also see that jump up again within that the next few years too in different areas. Does anybody have any specific questions about the budget? And I apologize, I can't walk through every little step as to what is included within that budget, but it does lay it out pretty directly as far as what we're looking to accomplish within each of the fiscal years.
Did you do an ARPA grant for this too?
We did. We wrote for an ARPA grant for a food hub.
And other than through the Board of Health, do you have any other funding resources?
Mm-mm. No, when we first started the Dubuque County Food Policy Council, we received, it was $20,000 for the council. That was utilized in the form of grants. So that's not something that that went out to community members that were focusing on a lot of these initiatives. So they had to apply for the grant and then we awarded that. This was the last year that we were able to do that, and now it will be in the form of the purchase of service. So we are encouraging those that fit within these initiatives to apply if it's something that works within that. But we would appreciate too if some of these issues are taken into account when looking at those purchase of service grants too.
And do you recall, Tom, we've budgeted for money to the food council previously, right?
We have,
And then does that money we just get that from the supervisors? Is that right?
that's correct.
Okay.
It came from the supervisors.
Okay, and so for your fiscal year 23, you're asking for $58,662.
Yes, that is correct.
Okay,
And what is approved, do you know, Samantha?
I don't believe we have any funding for Food Policy Council in our approved budget for FY23.
Because as I look back at the minutes from December, when we discussed this, I had them here just a minute ago. There was, we discussed all of the budget requests that were put in front of us. And the health department 5-year restructuring, we as a board supported that. The food policy, food systems proposal, which I believe was the food hub, we supported that because we had supported earlier. The food policy improvement request, we did not support that. Mercy One, we did not support that.
so if we wanted to fund the food policy council, we would have to ask for a budget amendment.
That's correct. If we wanted to do anything for 2023, it would have to come in the form of an amendment. And I think those are being written.
We just submitted our last ones for this past quarter, so I don't know when they would be due.
I think it's July.
I want to say it's by the end of July.
Okay.
But I do know that part of your ARPA proposal, the increase personnel was partially to help with the food policy.
Yep, there is
So-
one position in there, the lifestyle specialist, that would focus more on Food Policy Council work too. So to Whitney's point about giving a staff person in our own department more time to focus on that council, I think would be helpful.
And that is what we're asking, is just dedicated time to help us move these initiatives forward and having that. And then also the additional budget to be able to do the marketing and the outreach and the website is a key component, because a staff person can only do so much if they don't have those additional resources to do that. And we've realized that's a huge part. A large part is just on going out to our communities and understanding what their needs are and bringing them to the table around food, right? And having an understanding of what their needs truly are.
Now, I thought the supervisors were spinning us food policy council out of the health department. Am I imagining that?
I think with our grants that Whitney was talking about, those are phased out and those will be the purchase of service like she was mentioning. So that goes through the supervisors.
Okay.
I don't know that there's been any conversation about separating from the Food Policy Council. I don't think so.
I think that would require developing a separate entity
Yeah.
that reports to the Board of Supervisors.
Right.
And that was not what was being planned.
No.
Okay.
I do know our contract is ending soon with Danielle and also Candace too. So having an understanding of what that looks like for us as a future as a council. And just understanding if you're supportive of this initiative too, and these goals that we are looking to drive forward.
So are you asking us, the Board of Health, to seek a budget amendment to budget you in 2023 for $58,662?
I am, yes.
Is that something that we could take action on tonight? Or
I believe so, but
It's not on your agenda.
No,
It's not.
No, the only thing on our agenda was an update presentation.
okay. All right, well, thank you very much.
You bet.
Whitney.
Thank you. If you
Appreciate
need
it.
any other information, please let me know. Thank you. I will reach out to her.
Yes, please.
Enjoy this weather and sun. It's nice that it came out.
Thank you very much.
Thank you.
All right, our next matter is a Dubuque County Health monthly update and COVID-19 update. Samantha? I'm gonna step out for just a minute.
Okay.
You go ahead.
Okay, this is our just monthly COVID update. It's gonna look pretty similar to last month, really. Our community levels, according to the CDC, are still putting us at a low level. And like I've mentioned before, this is based on new COVID cases per 100,000 people in the last 7 days, as well as new COVID admissions per 100,000 in the last 7 days, and the percent of staffed inpatient beds occupied by COVID patients in the last 7 days. And you can see our statistics as of last Thursday down here at the bottom of the screen. And most of Iowa is also at a low level. If these metrics, the first one we're at 153, if that hit 200, that would move us to medium. And then the bottom two, if we hit 10, that would also move us to medium.
Who's the red one?
Yeah.
I am not sure what county that is.
I
have
think
to
the
look.
yellow one in the south might be Johnson County.
I can look that up.
It's just curious why those northern counties are medium too.
Yeah, I'm not sure. on that
Never
one.
Minnesota.
Yeah, that would be Johnson. Or
So this is just an overview of what our COVID cases have looked like as a trend since the start of the pandemic, March 1st, 2020. You can see we were experiencing a peak in cases compared to what we had seen back in the end of March and April. It looks like that is starting to tail off, but I think it's too soon to tell for sure. This is just a breakdown of our COVID cases in the last 7 days and our hospitalizations in the last 7 days. And that was updated this morning. You can see we had 124 cases as of today in the last 7 days. So like I said, that's kind of trailing off compared to last Wednesday when we looked at this data. And our hospitalizations have stayed relatively the same for about a month now. But since we last met, there's been additional 3 deaths related to COVID-19 in Dubuque County. So we are now at 297 deaths total in the county. But the incident management team continues to meet with our higher education, pre-K to 12, and our providers to discuss these data changes and keep following the trends with them. So everyone is in the know and prepared. And then we're also receiving hospitalization data on a weekly basis too in those meetings. This is a breakdown of our positive COVID cases since the last time we met. And I believe last time we were here, older adults were leading those positive cases, but now it's gone back to 19 to 24-year-olds. And we know that they're leading our cases overall. If we look at this same graph from March of 2020 to now. So this aligns more with what we're seeing overall in the pandemic trend. These are our variants by month in Dubuque County. Similar to the past few months, May is showing 100% of all of our positive cases are Omicron, and this is just an estimation based on sequencing from the State Hygienic Lab. But this is also looking the same for that sequencing in Iowa as a whole. They're also at 100% for May so far. This is kind of hard to see, I'm sorry. It's our vaccination data for Dubuque County and IDPH data, which I share with the Board of Health every Friday. We were now told is being updated monthly. So that changes the reporting a little bit. That's why I've also included this CDC data. So according to IDPH, as of May 3rd, 70.74% of the county's total 5 and older population has either completed their vaccination series or is currently in the process. And that's the same for 97.6% of the population that are 65 and older. And then 57.35% of our residents 12 and older who have already received or who are already fully vaccinated now have their booster dose as well. If you go on the CDC website, they're tracking this data all the time, of course. So these 2 tables at the bottom were taken from that website. And I wanted to point out on their the data that they're giving, 56.2% are fully have their first booster dose. That does now include their second booster as well. So those stats are combined, which might make our percentages for booster dose look a little confusing. This is more information on vaccinations. You can find a full list of where to get a COVID vaccine on the county and city websites. And our Visiting Nurse Association is still hosting walk-in clinics for vaccinations on the third Monday and also every Friday. And they can provide booster doses at those vaccinations as well, or at those clinics as well. And then we're still staffing the Sleeves Up phone line with the city of Dubuque. And then the VNA is still staffing their phone line to answer just general COVID questions, or maybe more specifically questions about isolation and quarantine. And since we last met, the VNA has received 49 calls to that line, now putting them at 289 since we started that. This is just some testing information. The incident management team is recommending that after a positive COVID rapid test or after receiving a negative rapid test result while having COVID symptoms, consider confirming that result with a PCR test. And our office here, and as well as the VNA office, still provide the at-home test kits through Test Iowa. And you're also able to order test kits through the mail at covidtests.gov. Otherwise, like the vaccination information, all of the testing information for Dubuque County is on our county website. I meant to take that slide out, sorry, because it's copied on here. These are just some resources I wanted to share with the board and the community as a whole. There are places to access information on COVID treatment options in Dubuque County. You can find that at Test to Treat. And though it does show you where we can access those treatment options, you do need to consult with a healthcare provider first before getting them. You have to have a prescription. And then the CDC came out with 2 tools that I find really helpful. The first is a quarantine and isolation tool. And if you go to the link provided there, or even if you just search CDC isolation tool, it'll come up. And it has you press the start button and walks you through sort of like a text chat with the CDC. It asks you a few questions about symptoms, vaccination status, things like that. And then it will come up with a result for how you should quarantine or isolate based on the information you've provided them. So I found that really helpful when I was in need of it. And then a new booster tool they just came out with, I believe at the beginning of this week or last week, does the same exact thing, but it provides you information on whether or not they believe you're sort of like approved or recommended to get your booster dose at this time.
Were these in the agenda packet?
They are not, but I can get them
Yeah,
out.
if
to
you
the
could
group.
send those, that'd be great.
Yeah, I'll get them out to the group, and I'll, after I stop sharing my screen, I'll put them in the chat too for people on Zoom.
And is the booster tool for the first booster or the second booster?
It's for both.
Both.
Yep. Yeah. Yeah, so those are really helpful. Those are 2 of the things we get calls on the most at our office. So I love that the CDC put this together to help people get the answers for themselves. But I think, yeah, that's my last slide. Not tons of differences in the COVID update from here to, or from last month to this month. But if there's no questions related to that, I can go on with our just general department update.
Yeah, I just want to make a quick comment on the current situation with Omicron. You might hear that too. There are a couple of subvariants of Omicron that are included right now in what we see, what you showed us in the county overview. What we don't know is right now, I don't think so, but what we don't know for sure is that they don't make you sicker than the original variant or other variants. But what we have indications for is that they're more transmissible. And that's probably one of the reasons why we see this uptick right now that you described, that if you get, let's say, 1,000 people infected and instead of 100, and 10% get so sick that they might need to see a hospital. If you take 1,000, that's 100 that get into the hospital. If you take 100, that is only 10 people. So I think the little uptick we are seeing here might be related to that, to these variants. I think as of now, I would just observe it because I did not see any clear evidence in the literature that the game has changed. But it was a little bit concerning if probably for all of us, just to see that there was this blip. But let's keep an eye on that for now. So far, nothing that would indicate that there's a major game change here.
Thank you.
Thank you. I think with that too, there's still unpredictability with COVID-19, and predictability is what defines an epidemic. So I don't think we're there yet. And like Dr. Schultz said, we are still keeping an eye on that.
Yeah.
Okay, then for our general department updates, since last time we met, we've tested 69 private wells in Dubuque County. So every time we come here, we have a few more, a higher number to report back, which I am happy about. And we're in our last quarter of that grant. So we're on track to finish spending it down by June 30th. And Bailey will be here next month to provide a end of the fiscal year report on that for you. And then I was going to share my screen quick. We are working with a few community partners on a tuberculosis testing event in Dubuque County that will be next Saturday at Constitution Days, which is a Marshallese holiday that they'll be celebrating at Flora Park. It was a event initiated by the Iowa Department of Public Health to increase TB testing specifically in the Marshallese community and among Pacific Islanders.
Mm-hmm.
So along with IDPH, we've also partnered with the Visiting Nurse Association, Crescent Community Health Center, Mercy Mobile One, their unit will be there, and that's what we'll be using to provide the testing at the event. And then Monsoon Asian and Pacific Islanders in Solidarity. So I'm excited about that, and I'm happy we have such a big collaboration to address this need in the county.
That's great.
Or one of our doctors, do you know, what is the recommendation for TB testing? I mean, when is a person supposed to get tested for TB?
Hendrik, Dr. Schultz might know more, but the reason that the this project targets the Marshallese community is because they are not tested when they enter the United States.
Okay.
Yeah, some populations in the world have a high prevalence of dormant TB. That's part of the problem. And unless you test it on entry, which does not help you, all it could show you if there are no symptoms that you had the disease, you don't have a good sense of like how prevalent is it. And from what I recall, there were cases of tuberculosis in the Marshallese population. Also when I was a fellow in Iowa City. So this is something you see once in a while. And I think if you think about what was shared with us before, that the Marshallese community is also very tight in close spaces, living together, sleeping in the same bed. They are a high-risk population if they have even a small proportion. So screening them for tuberculosis from a public health perspective and from an infection control perspective makes perfect sense, because if you treat dormant or latent TB, because you diagnose it early, you are 3 to 6 months on one drug. But you eliminate practically the risk for a massive outbreak in a whole population. So I think that makes a lot of sense to me. Does that answer your question?
I was just thinking, like, for the general population, when are people supposed to be tested?
Well, I mean, obviously in healthcare, if you're immunocompromised, let's say if you are a transplant patient or if you're HIV positive, that is when you definitely will be tested. You will also be tested, for example, when you get on biologicals that suppress your immune system, like TNF alpha blockers. These are drugs that you use in rheumatology to suppress the inflammation, but the price you pay is potentially that you also suppress your body's suppression of tuberculosis.
Okay. All right, thank you. That's informative.
Does it say on here, like when and where they go to get it checked, their arm checked?
So these are actually blood draws to avoid them having to come back.
Okay, I was wondering. Okay, my daughter just had to get TB tested because she's working at the University of Iowa Clinic. So, and she has to keep going back and getting tested.
No, it's not the one you need to read. It's the other one.
Perfect.
I will provide, IDPH provided us with additional blood draw kits and the skin test kits. So those will be at the Visiting Nurse Association and Crescent for people who do not get tested at this event, but are still looking for a free test afterwards.
Great.
Yeah. And then we're also, the incident management team is preparing for our tabletop exercise to practice an emergency response drill in Dubuque County. That'll be taking place next Thursday. And my last update was that our department is working with the Visiting Nurse Association and the Auditor's Office on our upcoming Board of Health contract with the Visiting Nurse Association. So that'll be presented to the board next month also, along with a new reporting tool for all of our subcontractees and our grants, so that there's some continuity in how we're reporting, I guess, to make it simpler on the public and the Board of Health as well. That was all from me, though.
Thank you.
Mhm.
How is your workload there at the health department?
It's always crazy, busy.
Busy?
Yeah, but I think we're getting more involved in the community, and that's what I really wanted to see from the health department, so I'm happy.
Right.
Yeah.
Very good, thank you. Well, the Board of Health, I'll speak for the Board of Health. We very much appreciate you, Samantha, so thank you. And thank you for your report. The next agenda item is the Dubuque VNA monthly reports. Stacy, welcome.
Thank you. So as Sam just mentioned, her and I have been meeting to look at a good way for me to report to you all as well. It's kind of changed over COVID, and I think maybe Tom would probably remember it used to be a really long report that was still missing some things. And I think every time I give a little information, I think there's more that could be said. And so we're trying to find a way to incorporate not only the impact of what we're doing, but where are we at with the funding and how is the funding being used on a monthly basis? And we'll submit this written prior to the board meeting, so it can get included in the packet, and that gives you an opportunity to see what I'm sharing prior, see your questions. So you'll start to see things a little bit different.
Yeah.
Next month, we're really excited. Sam and I have been working pretty close, and so I think we're getting to a spot where we're both really comfortable with what we'll be sharing, and it'll be nice for me to know what all you need as well. So some updates on the grants that we do contract with you, the immunizations. Year to date, right now, we vaccinated 859 children. We've provided 1,930 vaccines. And I took a look back at where we were at this time last year, just to kind of get an idea. Are we kind of in the same spot? And what I found was interesting is we've increased the number of kids we vaccinated 16% from this time last year. And we've increased the number of vaccines by 40%. And so to me, that's a good indicator. For one, we have added in COVID vaccines for those that are age eligible. And we've also been really, really pushing the education of getting all recommended vaccines when they come in. And we had a kind of a trend where some families would choose to only take several vaccines rather than all. And I think it's showing that we're getting back where we want to be with those vaccines. In terms of our funding through the immunization grant through Iowa Department of Public Health, we have used 100% of the funding. So we go through it very quickly, and we look for other opportunities to get additional immunization money. I know we partner with Early Childhood. They help provide funding for that as well. And we do utilize our Public Health Services grant to help pay for vaccinations too, knowing that this amount of money is very small. Within our public health grant, a couple updates here. Communicable disease. So far, year to date, we have worked with 3 crypto cases, 1 E. coli Shiga toxin and 1 Shigella, or I can never say it right, it pops out really fast, case, along with any of the COVID additional that we've been trying to work through. We've also been following 2 perinatal hepatitis B babies. And we are still very active with TB right now. We have 3 latent TB infections that we are treating, and we are working with 2 active TB cases that we're providing the DOT treatment for. So we're staying very busy, and we've had a lot of sputum collections over the last month or so. And as Sam mentioned, we'll be participating in the Marshallese, the Constitution Day testing event. And at that event on site, we will be providing COVID vaccines. And then we will also be providing the TB skin test the following week at our office. And just based on timing and with Memorial Day, we were afraid to do the TB skin tests on that Saturday and not be able to get people in to get them read. So we felt it was better to collect the information there and bring them back into our office to do that. And then any follow-up for any cases that come out of this testing event will come through our office as well. In our CareNet department, I think these were some questions we had last time, was the homemaking and home care aid services. We currently right now have 66 patients open. We have provided 722 homemaker visits this year so far and 397 home care aid visits. And the difference is our home care aides do a lot of personal cares, bathing, dressing, while our homemaking does light maintenance, cleaning, and that type of support. So prior to COVID, when you look back at 2019, we actually averaged around 81 patients at a time. Sometimes upwards as high as over 100, and we had almost triple the staff that we have now. COVID played a huge part of that, and part of it is the patients that we are seeing did not want people in their home out of fear. They also, it's a hard position to fill. We struggle with staffing for this position. Over COVID, I think we lost a total of 5 homemakers and home care aid staff. And so knowing with all the changes coming with public health and not knowing what they were at the time, we kind of stepped back a little bit from filling those positions so we could sit down with Sam and make sure that this is something that we're going to continue doing. So we hope to have more staff in that position to bring that back up where it belongs. I know we keep, right now we have 50 people on a waiting list. And so the need is clearly there. I know when Becky was here last month, she had mentioned that she's starting to see a downward trend from some of those agencies that are providing the service, but we still see a need. There's a large gap of individuals that want to remain safely in their home, and these small support services will do just that. And so we definitely prioritize it and continue doing it. So hopefully staffing we'll get a little better, and now that things have opened up a little bit more, and it's with COVID, we've seen people really want us back in the home, and we do very good screenings on our staff and on the patients that we see in order to keep them safe, knowing how at risk they are. Within that grant, which includes, the communicable disease follow-up, our homemaking home care aid services, along with some of our immunizations and our audits, we have 19% of the grant left. The grant ends June 30th. We'll have no trouble spending that all the way down before then. So we are monitoring that pretty closely, but yeah, we're right on track to spend that all. Our BCC Wise Women Care for Yourself program, that's a little bit different. We get paid by screening, by the number of screenings completed. And so we do get outreach funds, and we anticipate spending all of our outreach funds before the end of the grant year. We've been able to include our Marshallese Community Connector in this program and into the outreach funding, and that's made a tremendous difference on getting some of the Marshallese population in for screenings and things like that. So it's been a wonderful connection, and one that we've been able to promote throughout Iowa Department of Public Health. We're continuing to schedule screenings, but we're starting to finish up as the grant year is coming to a close. We have a certain deadline where no screenings can be scheduled after a certain date in order for them to finish billing and things like that throughout the grant year. We did bring in 2 new providers this year, Historic Bluffs and Hillcrest. That'll help take our referrals and help get these women in. And as I mentioned with our Marshallese Community Connector, we've really prioritized targeting our Marshallese and our Latinx population. So we're excited over the things that we've been able to accomplish. This grant covers several counties, and so the needs are definitely there. Our tobacco prevention and control, Vicki talked a little bit about this earlier. We have about 44% of the grant left to spend, which is right where we assume we will be. We will definitely be spending all the grant dollars down. She has some marketing money that's coming out of there. And we brought in additional staff to help do some of the community and school educations. And some of the things that Vicki's been doing, she's got a new business policy submitted to Iowa Department of Public Health. We have then completed 6 of our 6 policies. We have one new child care center policy submitted to Iowa Department of Public Health, which completes our 5 of 5 policies that should be submitted to Iowa Department of Public Health as part of our goals. All of our maternal health nurses are now trained in ask, advise, refer processes of Quitline, Iowa. In March of 2022, we did 8 presentations reaching 251 contacts for safe sleep, tobacco, healthy hometown meeting, our Pacific Islander Health Project, Wellness Coalition, Hillcrest Community Forum, at our Board of Health Open House, Clarity Clinic in West Dubuque High School. In April of 2022, we had 10 presentations reaching 445 contacts. And that includes Mary's Inn, Clark University, the River Museum, Hillcrest and New Day Clinic, Beckman Junior and Senior High, Dubuque Area Substance Abuse Council, Drexler Middle School, Roosevelt Middle School, Washington Middle School, and we've scheduled, she actually finished it today, Cascade High School, for 2 presentations for health classes there. And then we're continuing to work on our billboard campaign, which will run through June. So I feel like she's done a great job at incorporating not just this grant, but also intertwining it with some of our other grants as well. When she talked about maternal health and things like that, all these grants kind of combine because their same focus is public health and access. And so it's been great that we've been able to train and cross-train some of our staff to do all of this. And I know at our at the last meeting, we just talked a little bit about services throughout our county versus services within the city of Dubuque. And so I did take a look, and some of our programs, the data is just not available for me to extract by zip code. All of our services, all 34 programs that we have, are offered throughout the entire county. We do try to connect outside the city limits as best we can. And I know of the ones I was able to actually pull the data from immunizations. 25% of the immunization children that we provide vaccines for are outside the city limits and out in the county. Our homemaking, home care aid services, those tend to vary because people will drop off and we will admit new people. But we usually average around 10% of those are outside in the county as well. I know all of our providers that we work with, we do target those out in the county, the schools and things like that. So we're trying to find ways to pull some of the software systems that we have through Iowa Department of Public Health to get more of the county data, which will give us a good snapshot as well. And where should we be focusing and things like that. So I'm hoping that as we continue to dig through these, we find easier ways to get some of this data. But that's kind of where we sit with our programs as an agency. The only highlight I really have today, I'm very excited for, United Way has funded our representative payee program for the last 2 years. This was a competitive year this year, and we were chosen to be funded, and we were funded at the full ask that we had submitted an application for. So we're very excited that that program will remain through another 2 years with United Way. So all of our Iowa Department of Public Health grants through our subcontracts have been submitted. We're waiting for information on some of them. I know I've seen some negotiations coming through our Clayton County, which has similar grants. And so it looks like they're moving through and getting those contracts in place because a lot of them start July 1.
Thank you very much.
You bet.
Busy.
Vicki,
Yeah.
I have one question.
Uh-huh.
And it's kind of related to in the city of Dubuque and outside the city of Dubuque. Does VNA have any contracts with the city of Dubuque Health Department?
We do. We
Okay.
do. We work
And
directly with
I
them.
don't mean to get into the detail, but I just wonder.
Yep. We do. We hold several contracts and do several programs with them as well.
Okay, all right. Thank you.
Thank you very much.
You bet.
This meeting's going a little long. Does anyone need a break?
Let's take a 5. I make a motion to take a 5-minute break.
All right.
Second.
All those in favor? Aye.
Aye.
Let's take a 5-minute break. We'll be back at in 5 minutes.
Is the interview going to be here tomorrow or?
I think in the office. Yeah, because I think I'll be the only employee there at the time. So, yes.
You don't need me anymore.
We're gonna talk about that after action report, but that's all. So, how are you? Good.
Is there anything?
Just gonna talk about. Questions, but
Well,
I think that's all.
I was gonna
I don't
say,
think there'll be other questions, but like.
words about it, but I don't,
Yeah.
I don't think I'm going to.
Oh, yeah, I'm gonna sure. I would.
And then ask
These guys' presentations are invited, that they're told there.
yeah, certainly.
Yes. Yeah. Yeah. What did we say that was again?
that's what
Yeah.
makes us go long. And then we have so many things to talk
June
about.
1st.
Yeah,
5
so
p.m.
I'm not gonna,
Yeah.
I'm working, I'm working.
Thank you.
on it.
It's all about calendar invites.
I kind of live by them.
I do too, otherwise I'll forget. So.
Yeah, I know.
No,
All right, so you're good, you don't need me.
No, thank you so much. Tell Vicky, thank you too.
I should have.
Yes,
I was
Yeah.
going to say, even if we
Yeah,
don't get
yeah.
some
It's good though.
resolution.
All right, well, if you have any other questions or something comes up, just text me.
Okay, have a good night.
Bye, guys.
Bye.
Bye, Stacy.
Yeah. Well. And do some exercises. Remember our joints.
Do a little jog around the
Yeah.
building.
Yeah.
Is our microphone muted or are we still?
Are we muted, Sam? Go back into session and the next matter.
Okay, now
next-
you should get.
The next matter on the agenda is an action item, and this is going to be a discussion concerning the Assistant Director position for the Dubuque County Health Department. And just by way of introduction, we all know, we got the notice that Samantha has resigned to go and get her PhD, which is a wonderful thing.
Bravo.
Thank you.
But we'll miss
We'll miss
her.
you.
Yeah, I will miss it here too.
But
But she was so thoughtful and gave us almost a 3-month notice, I think. She'll be leaving by August 12th, is it?
Yeah.
So we have a couple of months, and I wanted to get this on the agenda because Samantha did reach out to me, and Samantha, I'll just give you the floor about how you think it should be filled or when you think it should be filled and that type of thing.
Sure. My thought with providing a 3-month notice was it gave us some time to plan for what it might look like at the end of summer. And I think the most important thing for our department historically is we need some cross-training and more involvement in the past supervisor training the new supervisor or any position that we have. To be honest, it's felt like some of our positions have had to start from the ground again and make their way up on their own. And I think that's set us back and that sets any person back. So I wanted to be able to do my best to help the next assistant director be prepared before I leave. So my thought with that was that this position could get posted, and we could see if people apply and are interested. And I'm hopeful that we'd find a good candidate that could start in that position before August 12th. And then I would still be here to train them on some of the basics.
Sounds perfect.
And I agree with that. I just don't think it would be fair to Bailey to be here all by herself. And Bailey has not served as the assistant health director, so she couldn't train that person. She could help train the clerical person because she's done that role, but she couldn't help train. So I think time is of the essence.
Yeah, I think we've done what we can to keep the department going, but we are small and it's hard for us to all do each other's jobs. So this would be the most helpful to the staff we have now.
Yep.
I have a couple thoughts, and I appreciate what you're saying. The one thought is that, first of all, it would be unusual to bring someone in that far ahead with the way the county HR system has operated in the past. We don't normally bring someone in until the person's gone.
Right.
But I think it's a great idea. The other thing is with the incoming director, I'm just wondering if it's fair to the incoming director to hire an assistant for that person before they get here.
And that was one of my concerns too, was, so this new director who could be coming from outside of Dubuque County is probably coming from, they're not gonna know anybody, they're not gonna know the names, or they'll know the qualifications, but yeah, I think it's an unfair onus to put upon a director who's already trying to catch up on their job to hire a person for a job they don't know. And technically the job is open because Samantha has moved up into the executive director role. So it's not like it's a double dip because there's already that assistant director position open.
So Tom, you were kind of saying that you didn't think it was fair to the new director to hire someone before they come.
Right.
And you're
You're
saying the
I am agreeing with that.
Okay.
Yes, that I don't think it's
But-
fair to expect the new, to wait and expect the new director to hire.
That's what he's saying.
Yes.
Oh,
That is-
so that's what you're saying, Tom, because
Yes.
You guys are not saying the same thing.
We're not.
No.
it doesn't
No.
sound like you're saying the same thing.
You're saying we
Different.
should wait till the,
No,
no, that's what I'm saying.
I'm not saying. I think we need to be moving. But I think at the same breath, it's unfair to, you're setting a person up as a new director and they don't have any voice in who's going to be the assistant.
On the
Well,
other
then we are
hand-
saying opposite things.
On the
yeah.
other hand, though, there is no department to help them
No, there isn't.
get entrenched into the department. So I think, although it's not conventional, it would be conventional to let the new director hire an assistant. But I think that this is a different setup, and I would think we need to go ahead sooner.
Yeah, I see both sides.
Yeah,
Okay. I support that if we can get the backing of the board of supervisors to go ahead with filling that position.
Yes, do you have any thoughts?
Well, a couple, yes. I would support trying to fill that position earlier than Samantha's vacancy, because I think, it's helpful to have some cross training. I also think if Samantha wasn't vacating the position and stayed on as assistant, or whoever was in that position, the incoming director wouldn't have a choice in that either. So, but my question is, do we need Board of Supervisor approval because of we would be paying two salaries?
Dawn Sherman was with us. I'm not sure, I don't think she's here anymore though.
She's not here anymore. I did talk to her about the plan on Monday. She thought that because we're short a person and we've been short a person for a while now, we have money remaining in our budget to hire another person. She thought that would be fine. We do need Board of Supervisor approval to have any job posted. So that's why that would have to go through the supervisors.
Yeah.
Could I just give a perspective that might help you. This will be questioned. It always is. And we do not, Tom Beshan is correct. We do not usually hire until the person has left. However, there was, in my term on the board at the jail, we hired a person to be trained due to the extensive training requirement and that there was no other person to do the job. So here you are with no other person to do the job. And we did budget that so that there would be, I think that was a good 60 or 90 days overlap.
Yep. That makes the transition easier. I would agree with that.
Is there a motion to seek the posting of the assistant director job?
I would-
Okay,
I move to post for the assistant director job as soon as possible.
and
I
is there a
second
second?
that.
Okay, any discussion?
I did put the job description in the agenda packet. There were a few suggestions that I had.
Yeah.
I don't know if now is the time to go over that or.
Let's handle that after we do this motion. Okay, thank you. Any more discussion about getting the job posted? Hearing none, then let's take a vote. Everyone in favor of the motion, please say aye.
Aye.
All right, and then Samantha, it passes, and so we will be filling out a requisition or something with Dawn. Then what, do you want to go ahead and talk a little bit about the job description?
Sure, I read it over and there's not a ton that I would change. I did send this out to the Board of Health in advance. I just had a few highlighted sections that I added. What I see the assistant director position doing is being sort of like the fiscal agent for our department, focusing on budgeting, managing our grants financially, things like that. So I added in some verbiage that focused more on that. Otherwise, that's really all the changes that I made.
You really didn't take anything out, did you?
Not
Online.
You took out quality improvement.
There was under knowledge, skills, and abilities. Page 2.
Yep, I took out that first part, Tom, you were just talking about under general definition of work. Because it's
Okay.
mentioned in another place, that Iowa grants.
And
So I
then,
didn't think that needed to be there.
yeah, and then under education and experience, are you taking out bachelor's degree in higher in public health and health administration?
Yeah, and I wanted to reach out to the Board of Health and see what you thought about that. Like I said, I see this person being more focused on the financial side of things and the director being more focused on the public health side of things. Obviously, more people with public health experience in a health department is ideal. But I had changed that just based on the work that I've been doing.
Just as an aside, when we did the, Amy and I interviewed Patrice Lambert as she was retiring. And she said, she thinks that one of the positions in the health department, it's very helpful if one of the positions is an RN. So,
Yeah, I personally think leaving in public health or health administration is fine
Yeah.
because it's a health department.
yeah.
Yeah.
Samantha, this is Ann. Can I ask you, have you talked to the auditor about this idea that there'd be finance and management? Because I know the auditor, with the grant programs, the auditor might be adding additional staff inside the audit department. And then the focus on finance and management, I would just like to see the auditor address that as well, because even though that's what you've been doing, it's because you and the auditor have been learning all this together at the same time.
Sure. I've worked with Megan in the auditor's office to help us set up our own tracking system for our grants and things like that. So she has helped us kind of gain more control over the financial side. I did reach out to the county auditor. I just have not heard back yet.
Yep.
And maybe actually that could be moved to the essential functions or secondary functions that could be working with the auditor.
Yeah, I can add that. I did add it in our proposal for more staff. So I have the verbiage already, so I'll copy it into here.
I'm sorry, like Hendrik, I also have to leave for another meeting. Thank you, everyone.
Thank you.
Thank you.
Yeah, I like your addition of the within the first 6 months for the water testing. You weren't certified when we hired you, so.
Right, no. I was not.
I I like having the background in public health. I think that's, you know, that's a must for someone coming in at this level.
I've added, there were 2 parts about that that I had crossed out, but I added them back in.
Okay.
And maybe instead of must have experience, preferred experience in finance and management.
Sure.
Since, you know,
Let's
since this should be working with the auditor.
Experience in finance and management is preferred,
Yeah. Yes.
not must.
Right, yes.
With those changes, is there a motion to adopt this job description?
I would make the motion that we adopt the job description as amended.
I would second.
Thank you. Any discussion?
And so this will be sent to the Board of Supervisors to be placed on their
Yeah,
agenda.
Yep, I'll send it tonight, so ideally it'll go on their agenda for Monday.
Great.
Yeah, that and the requisition.
Yeah, I have to check on, or I'm sorry, what requisition?
For your job, and that won't go to the supervisors yet this week, will it?
The one we just edited.
No, the
Right.
request for your job, you know, to fill your job, the posting, will
Oh,
that
yeah,
go?
no, that's what I meant, sorry.
Will it go?
Yeah,
Okay,
sorry, yes, those both will go on Monday.
okay.
And
All right.
is the clerk, that's already on there?
That one is completed, yeah,
Okay.
yep.
Yeah.
Oh, that's right, because you're doing interviews.
Right,
Yes.
right. That one is-
It's a long meeting.
It's been long.
I know.
All right, so any further discussion on adopting this job description? Hearing none, let's take a vote. All those in favor of adopting the job description for Assistant Health Director, say aye.
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 All opposed? Okay, it passes. So that part's finished, I think. That will go before the supervisors with the job requisition, and then I assume we'll just be advertising the way the county always advertises for jobs and.
Yeah.
Okay,
And I think Becky Nowichuk has helped us in the past with
Oh,
getting that out through the IDPH.
so great.
Okay, yeah, I'll send the posting to her then.
and to Iowa City, the one at the University of Iowa, the public health school.
And does Drake have a public health?
Not that I know of, I can check.
Just says no.
They do not.
Okay, so moving on then, I think we're finished with the assistant director position. Number 9, unfinished business, and we have the Dubuque County Health Department ARPA proposals. We talked about the big one. Oh, I'm sorry.
What about 8B?
Yeah.
I don't have an 8B.
IMT project proposal request.
That one was updated,
Oh,
the one I sent out on Tuesday.
I see.
That's okay.
Sorry.
That's okay. That was the after action report proposal from the incident
Okay.
management team.
All right. So let's go ahead with that. And Samantha, you can speak about that.
Sure. So after a public health emergency response, all counties are required to complete an after action report that sort of goes over the logistics of our response, the lessons that we learned, what we would do differently in the future. So we have to complete one for COVID-19, which I'm assuming is the biggest after action report these counties have ever completed. Because we'll be looking at the past 2 years as a whole and our response over time. So meeting with the incident management team, we talked about hiring a company, an outside company to do the work for us and complete some focus groups, surveys with critical groups like the Board of Health, the incident management team, other partners that were involved in our COVID response, and compiling all that information to develop our after action report. And this is actually what Lynn County did. Theirs cost about $40,000 and they outsourced it to another company. And a lot of what is in our proposal came from Lynn County's proposal, because what they had put together, the incident management team thought was really great. So this is a request for funding that would get posted if approved by the Board of Health, for us to start receiving applications from other outside companies and proposals for the work. And then the incident management team would be responsible for reviewing those applicants, selecting a company to do the work, and then working with them throughout the process to have it completed.
Is this shared cost with the city of Dubuque's health department?
The city of Dubuque has offered to pay for things related to city-specific data. Otherwise, this would be a Board of Health cost. And you'll notice in our proposal, we don't talk about where the funding's coming from because that's still an open-ended question. Whether that would be funded directly by the board or if the board thinks we should take this on to the Board of Supervisors or possibly have it as a ARPA proposal. I've talked about all sources of funding with Ed Raver, working with the county supervisors. So I would leave that to the Board of Health, but this initial part here would be posted so that we could at least start receiving applications for people.
So we would get proposals back, so we could make a request for the cost.
Correct. Yeah, those proposals that we receive after posting this would include a detailed budget.
Okay,
And we could go into negotiations with those individual groups about the budget cost.
but then we'd have to take that back to the supervisors for approval.
Correct.
If we, yeah,
Correct.
okay, well,
Do you have any idea what it might cost?
We don't believe ours would cost more than Lynn County's because of our size, and theirs was 40,000. So I do not know exactly, but I would estimate 30 to 35.
I think there's some money held back in our budget for COVID, remember? 'Cause
there,
it's
well,
like 25,
that
20.
has to be spent by the end of June, though.
Oh.
That there was 200,000 left, but I think we did put a $50,000 placeholder in the budget for the coming year.
That's what I'm talking about.
Yeah, I can look at that.
Yeah.
Yeah, and look at the timeline on that because
I think it's,
if we paid even half what's due, that would still help.
Yeah.
I think it's almost ridiculous to assume that health or any of the people working on the incident management team has the time to go compile
Right,
a report
yes.
like this.
Yeah,
Yeah,
I agree.
I would make the motion that we subcontract this out to an outside source for proposals for service from them.
I second.
Is there any discussion? So what?
I-
we're doing-
Go ahead.
Go ahead, Jess. So I
I
think
just
the
wanted, my question is, the RFP will go to who? So who selects the vendor?
The incident
Is it the Board of
management
Health?
team.
The IMT, okay.
Yep. That's how it's written in the RFP that I brought to you all.
So what we need to do tonight is approve the RFP.
For posting.
Okay. And does that obligate us to find the money or go after the money?
It does not, no.
It does not,
It is
okay.
also in the RFP that we could reject all proposals if we wanted to.
Okay. Would you accept just a friendly amendment to your motion? Sure. And it would be a motion to adopt or to accept or what am I saying? To approve the project proposal request for the Dubuque County Incident Management Team COVID-19 After Action Report. Would that be okay? That way we're just approving this project proposal request.
Yes.
It's not obligating us to anything else. Okay, all right.
Do
Okay,
we need to second that?
no, yes,
I'll second that.
okay. And then any discussion on this motion? Hearing none, let's take a vote. All those in favor of approving the project proposal request, say aye. Aye. Opposed? Okay, it passes. Okay,
So I'm wondering with the ARPA proposals, if we should table those. And especially since with the work session, we're gonna be talking about them, well, probably not mine, but talking about the other one. And we have no idea when the behavioral health fund's even gonna go before the board. So just in the,
interest of time.
times, yeah.
As far as, that's fine, and that's fine, I mean, that's fine with me, the one for the additional staffing, we've already kind of discussed, and we're gonna have further meetings about that, so.
Yeah. I mean, I think we should maybe bring this packet with us to that work session with the supervisors.
Right.
And look at it at home too, but I just don't think we need to spend time since we're gonna have a whole work session on it.
Right, I don't think so either, And then, as far as the proposal that you made, when the Board of Supervisors is ready to hear it, you know, if you want support or anything, let us know, so. Okay. So let's see, that was action items and unfinished business. Is there any new business? None is listed. Any board communication and reports?
The substance abuse board did not meet. Remember at our last meeting, I said we were gonna meet. Well, it never happened. And they never communicated that it didn't happen. And then Jess has been working, I think with, is it Melissa or is it? With,
yeah, go ahead.
well, no, you go ahead, Jess, because you know more about it than I do, but they might be taking this coalition over, so.
So I met with two groups or people. I met with the Harm Reduction Coalition and discussed the program which would bring naloxone or Narcan to community businesses. So I'm going to work with Evan Hansen from that coalition to try to get, the coalition has already kind of distributed some Narcan to community businesses, so we will just use that as a venue to hopefully continue to spread the word to local community businesses about the availability of Narcan, either through the Harm Reduction Coalition or through the IDPH funding. And then I did kind of speak with some local leaders, including Supervisor McDonough, just about the, what is it? I'm sorry, I'm blanking on the name of the group that you were going to see, Amy.
Substance abuse.
Yes. And so I've just been having a few kind of discussions about reinvigorating either that group or I think the opioid response team. And so we don't have any any formal decisions, but kind of just reinvigorating some discussion regarding which group is kind of going to take the lead, I guess.
Great. Thank you for that work, Jess, and thank you, Amy. Do you have anything else?
No.
So, yeah, okay, very good. And Dr. Marcia Horowitz, anything?
No, I'm, since our last meeting, Supervisor McDonough mentioned the difficulty with maternal OB care, and I'm working on that. And I don't have a whole lot to report, but I think that there is some avenue to improving the situation. So hopefully I'll have more to tell next month.
Wonderful. Thank you so much. Thank you for that work. Anybody else? All right. The next meeting, well, the next meeting will be when? Will be a special meeting, but our next regularly scheduled meeting will be June 15th, 2022 at 4:30. But I believe our next meeting will be
June 1st.
June 1st at 5 p.m., a special meeting. Yep. Okay. Thank you all. I don't see anything else. I think we've covered everything on the agenda.
Could I just ask, Sam, for those special meetings, will you send out meeting notices as well?
Yeah, I'll send a calendar invite.
Oh, thank you.
Yeah,
Good.
they have to be published for public.
It'll be published, yeah.
Yeah.
But maybe the calendar invite, if you have a chance, as soon as possible, just because
Yeah.
people, so people have it on their calendar.
And so that I have the right time on my calendar, because I punched it in, but you never know.
Yeah. All right, well, thank you. Next is public comment. At this time, anyone may address the board on matters of which are of concern to that person and which are not agenda items. If you're on Zoom, please raise your hand, state your name and home address. Please be aware that the board is limited in their ability to respond to such inquiries, and Iowa code prohibits the board from deliberating or acting on items not appearing on the agenda. Individual remarks are limited to 3 minutes. None?
Yeah,
Well,
Diane.
Oh, there's one. Hi, Diane.
Good evening, and I want to thank each member of the Board of Health for all the volunteer hours you are putting into the health of the community. What I'd like to address, and I know you can't debate this at all, but as you add new staff, either through the general budget or through ARP funds, you will also have to be taking a look at a larger facility or combining the staff of the department. Because now, I think they may have an extra closet to put somebody in. So as the county is looking at that, one of the Board of Supervisors mentioned on Monday to bring the county health department within the city limits. And she had already instructed county staff to start looking for a facility inside the city limits, Dubuque city limits. And I just would like to encourage you to take a look at either remaining out where you're at or continuing to be out in the county. I live in rural Dubuque, in unincorporated Dubuque, and I do not live within the city. There's a lot of individuals, and as we know, the county outside of the city of Dubuque is growing, and there's more also. And to have access to health services, I would just encourage you to take a look at keeping the health department not inside the city of Dubuque, where they already have a city health department. They have BNA, they have Crescent, and they have the healthcare providers within the city. I just wanted to encourage you to take a look at us that don't live inside the city of Dubuque when you decide where to locate your new staff that you will be getting. Thank you.
Thank you. Well, all right. Anything further? Anyone else want to talk? No? Okay. Is there a motion to adjourn?
I will make the motion.
Second?
I'll
Any discussion?
No, thank you for running an efficient meeting.
Really
long
We're adjourned. Thank you.
Thank you.
Thank you.
I'm sorry it went long. We're gonna,
It was a lot.
we'll make,
Yeah.
we'll make some changes, I think.